of the open meeting law, the public will not be allowed to physically access the school committee meeting, but it can be viewed using the Zoom link that was on the agenda. It's streamed live on channel 14 right now, and it's also going to be available on our YouTube page. I remind everyone that this meeting is being recorded, and any member of the public who would like to make an audio or video recording of the session can first notify me as chair, and I'll notify the public as is required by the open meeting law. Do we have anybody who is making a recording of today? I don't see any. Lori, do you see any hands?
No.
Okay. If that should change, please.
Took a little longer.
Oh, thank you so much. And I did, before we even start, I just wanted to address, we've had a couple school committee members over time request that we try to move our meetings back to being in person, particularly in a school if we can. And Lori and I have talked a lot about trying to figure out how to make that happen. And the issue that we continue to run into is that open meeting law requires that the meetings be available to every member of the public. So if every member of Falmouth wanted to come to our school committee meeting, they have to have the ability to do that. And with the limits set at 25 people, we just, I mean, obviously you can see that there are already half that many panelists. So it would really limit the number of people of the general public who could access the meeting in person. And that breaks open meeting law. So just so everyone is aware that that is the holdup that we keep running into, is the restrictions on the number of people. And that's different than schools, because schools aren't subject to that. So as soon as that number is lifted, or the local requirements for public meetings change, we will meet in person. And in the meantime, Lori and I keep talking about how to figure out a way to have us be in person and the public be able to access the meeting through Zoom. So stay tuned. We're working on it. Natalie, can you read our mission statement for us?
Sure. The mission of the Falmouth Public Schools. The Falmouth Public Schools creates world-class student learning experiences. Our Clippers are empowered to pursue their goals with curiosity, integrity, and resiliency. Our vision. Clippers are creative, inquisitive, and engaged learners who participate in their community as socially responsible citizens. Clippers effectively communicate and solve problems that impact the world around them.
Thank you so much. So like we do for all the meetings, we'll start with public comment. And just a reminder that public comment is limited to 2 minutes to items that are not on the agenda. And we can't take any action or make any comments or responses. It doesn't mean we're not listening. It just isn't permitted by open meeting law. So do we have any public comment for tonight? You can just click on the little raised hand. And I don't have power, I don't think. So the first person with a hand up is Becky Charles. Can we somehow make it so she can be heard?
Hi, can you hear me?
Can you hear me? Becky, can you hear us?
I can hear you. Can you hear me?
We can. Go ahead. Thanks.
Okay, so my question is about bathroom breaks, and particularly for young women or for 4-year-olds. So the first part is, what happens when a young woman, say 5th or 6th grade, gets her period for the first time, and she's sitting in class, she raises her hand to go to the bathroom, and the teacher says, no, it's not our bathroom break, you have to wait. And she gets up when it is her bathroom break, and there's a pool of blood underneath her. Who's going to clean up that mess? Who is responsible for that girl's mental health when she's embarrassed by the entire class for having blood all over her pants? And this is not going to happen the first time you get your period. It's going to happen multiple times. So that's part one of that question. The second part is 4-year-olds who have bathroom breaks, who have just been potty trained, who are afraid to ask to go to the bathroom. And when they are told no, they pee their pants or they poop their pants. Who's going to help them? That's my question.
Thank you. And like I said, we don't generally reply, but I have a feeling we can address that during our update from the superintendent. So Lori, Andrea, I see you have your hand up, but our public comment requires items that are not on the agenda, and you are actually on our agenda. I'm wondering if we can just hold you until the time, but I can't hear her, so that's not going to work. Can we?
This is not to an item of which I'm speaking.
Oh, okay, great. Thank you for clarifying. I just wanted to make sure we didn't break our own rules.
No, I would not put you in that position. It actually is in response to the school committee trying to find a place to meet. I'm sure there are many educators in Falmouth, and classrooms are set up that they can, you know, they would happily invite you to come in, and it would be an experience that you could have that would be potentially much like the students would, even prior to the students getting there. So I see 13 people on the screen before me, and the classrooms are set up, some of them for 15 or 16, and others up to 22, I believe I heard at the last forum. So I think there would be space. You could still Zoom and use all the safety protocols. So I'm sure there are educators that would welcome you into their classroom to do so. Thank you.
Thanks, Lori. Do we have any other public comment tonight? Okay, I'm not seeing any, but I am also not confident that I am scrolling through in the right way to see any. Lori, do you see any other public comment?
There are no other hands.
Okay, great. I just don't want to skip anybody. Thank you so much. So first on our agenda, although we're already behind, of course, is a presentation from Scott McGann. Can we, I don't know if we need to remove Becky and Lori, or if we can just promote Scott so that we can see and hear from him tonight.
Hey, everybody.
Oh, here he comes. Hi, Scott. Thanks for joining us again.
You're welcome. Hear me okay?
Sounds great.
I changed computers. It was a mess last week. So I'll keep the presentation short because I think the questions tend to come in a lot. I think the questions are probably the best avenues. Everybody agree. You guys probably have a lot of questions and try to do it that way. I have to say, our case count right now is 241, and it's been a nice, several days at least where I haven't had to change that number, which is always a great sign in terms of where we are right now. We're average, I think since about early August, we've had 4 total cases. The Cape in general had 6 today and been averaging 2 or so every other day or so, basically every day. So in terms of the disease itself, we're, in as good a spot as we've been in since the beginning. Obviously subject to any sort of change. I can only tell you what's happening today. Our percent positivity, if you want to call up that chart, Lori, like you talked about bringing up everybody's concerned, the chart with the green, the yellow, the red, and the white. Our percent positivity is 0.5% over the 14 days. That was of last Wednesday to 2 Wednesdays prior to that. That gets updated by the state every Wednesday. So 0.5% is, 5 tests out of every 1,000. So we're as a community, we're on the strong side for at least the Cape and for most of the state for the amount of testing we're currently doing. And our percent positivity is on the lower end. So that's kind of obviously the direction you want to be in. So as we sit right now today, our counts are good over the last, say, 3 weeks to 4 weeks. Our percent positivity is good. And we were in the green last week. And if we continue to have good, another good week or so, I could see us being in the white, the less than 5. So in terms of update, that's where we are in terms of the disease, in terms of working with the schools, the VNA has been working with, oh, there we go. There's a chart.
Sorry, I had a little bit of trouble. There you go.
So we're in the green. I would think because we had less than 5 reported cases over the last 14, we should change to white. But, the state depends on when the state pulls the data. So it depends on what days it's collecting. I'll pull it today for the last 14 days where they might be looking at it slightly different. I'm not quite sure because I don't have control over the ability to pull that chart out, to change that chart. And so that's where you're at as far as how the state's asking you. I'm sure you're aware of what sort of phase that you guys should be in according to this chart. And the other thing I'd like to mention about the chart too is, there'll be a time, let's say, for example, that, a congregate living such as a long-term care facility would have greater than 8 cases. Generally what happens is when they have a series of cases, they test everybody and they come out with some number, let's say it's 12. That will definitely change it for that week. But what needs to be decided and through the state guidance is they have to look at where the case is coming from as well. So, you know, a yellow, you need to have the conversation about whether you should vary what you're doing. But it's going to matter where the cases come from for obvious reasons. The congregate care setup is quite different from the general spread or general community. Community spread is a term that you use a lot. I mean, so that's what I have to start. I think maybe the best thing to do is that if you guys have questions, and we can go from there, unless you want me to give you some more detail.
No, let's move to questions, and then we can be a little bit more tailored instead of asking you to, you know, fill in or guess what we need to know. So Leah, go ahead.
I just have a couple clarifying questions. So the first was just around that graph. It was my understanding that they look at a 2-week span and then they average it per day. So that's probably why we're that color. Is that right?
Okay, yeah. Yep.
Okay. And then the second question I have, I'm wondering how, if I was in Falmouth, but my residence was in Tewksbury or something like that, would I be reported into our Falmouth numbers?
I've never heard that question before. I'm just being sarcastic. Yeah, I get that question quite a bit. Okay. It works in both directions. So yes, if somebody went home to their home in Connecticut, obtained the disease from here, they'll be contact traced in Connecticut. If, for example, like in April, what happens in April for Falmouth? Where do our snowbirds start to move back up, right? So the same happened in April where people contracted it in Florida were counted as Falmouth cases. So it works in both directions. So I would say this time of year, we import more people than we export. So you would have a tendency to have that on this side. And then the reverse will happen during most of the school years because we tend to export more people than we tend to import. Does that make sense? So we have a lot more people traveling to Florida. If they use their Falmouth address, they may contract the disease in Florida and count as a Falmouth case. I have access to that information, and that's what goes into the decision making. So I mean, I don't have access to what happens. Let me rephrase that. I have access to what happens of the exported cases that use Falmouth as a resident. So there's also the ability, because really what matters is that the person is being contact traced, not the necessarily. It's important when we talk about our metrics and what phase we should be in. But the most important thing is the person's being contact traced by someone. And that's, you know, you have to kind of figure out, if you're trying to figure out, you have to go and contact trace from the case where it was obtained. It's quite difficult for me to maybe try to handle that in somebody that lives in Utah. So it makes more sense that somebody in Utah is doing the contact tracing with more familiarity with the area. So that's the way it's set up nationally. That's the way it's set up at the state level.
Okay, can I just follow just for another clarification? So if I was not a Falmouth resident, I tested positive, I was staying in Falmouth, I tested positive in Falmouth, would you know that?
It would go to the municipality in which they reside. And then that person would generally, what happens is that health department would share it. You would share the case file. Okay,
so then you would get information from—
I could if they shared the case, right. If we shared the case and you know, and when they start to go across jurisdictional, that's what we have the contact tracing collaborative. You heard their term CTC, the state contact tracers. Those cases are best to give to the CTC to do their contact tracing because they have more ability to do cross-jurisdictional stuff. But yes, anybody, if somebody came here for the summer, contracted it, lived in Easton Board of Health doing the contact tracing, says, well, I've been in Falmouth all summer, they're going to share the case with us.
But so that would not be reported in our numbers.
Is our number, no.
Okay.
And quite frankly, like I said, we had at least a half dozen people from Florida contract it in April, which counted for Falmouth cases, but we're not in Falmouth. And so it works in both directions. So you can't, the number is not exact and precise, probably like you would say. There's going to be, you know, obviously a little bit of give and take between the different, you know, depending on where the person resides. And Falmouth's unique in we tend to have a lot of travelers and a lot of snowbirds.
Right. So yeah. So my question is the concern for right now where we have people from all over here, we might not necessarily know.
Well, I mean, they're not an isolated population. So if I'm not getting cases in Falmouth, it doesn't mean that only people that are not residents of Falmouth are getting it, right? Does that make sense? So there would be cases showing up in contact tracing. There would be cases that would show up that would indicate that there's community spread. Maybe we don't capture everybody because we have a lot of people that are from out of town, but you would see Falmouth cases. And the cases that I'm seeing aren't related to community spread, okay? It's, you know, you'll get a case where somebody traveled out of town. We've had that happen, you know, very recently. So, you know, it's not going to be, you know, a perfect number. Okay. You also have asymptomatic people. You're not going to capture them unless they decide to go get a test. So there's a lot of things other than that number. but it's the best number we have. And so that's what we use. But you would see it. I mean, if for example, you know, the lifeguard situation, not all those counted as Falmouth cases. They were not all Falmouth residents. Okay, so, but we knew enough to know that there was some cases with residents of Falmouth, right? So I would know, for example, if it was tied into a local, you know, restaurant, you would, and I saw 2 cases, then you could infer that there may be other cases for people that I'm not contact tracing. But if I've got 0, I don't really think there's a lot going on as far as other people getting it. Does that make sense?
That does make sense, because
Okay.
it would not spread to our Falmouth residents, right?
Yeah, you would capture some of that in the data.
Yes, thank you.
Right, so, okay. Other questions for Scott? Oh, I find that hard to believe.
Yeah, I was gonna say.
I mean, I have one. Andrea.
No. Go ahead.
Yes, Scott, you were saying that to get that 0.5% positivity, that's 5 cases in 1,000. And you said that was good for the amount of testing that we're doing. And so, you know, in particular, something came to our attention, and then I've also heard some other anecdotal instances of people testing positive when they're going in for, you know, other, like having no symptoms, but are doing some diagnostic testing, and, you know, that's one of the precursors to that, and then they're found. So do we feel like we're doing enough testing? Because I've also been hearing of people having difficulty getting tests.
Mhm.
So do we, what's your sense of where we stand on that in Falmouth in terms of the amount of testing we're able to do and that we're doing?
Well, turnaround time on testing is completely related to the laboratory's ability to turn over the test. So the more testing, you know, laboratories, you know, pre-COVID, you know, might normally have received 200 samples to test a day, now get 3,000. They have to gear up. So that part is there. The state's aware of it. It's on every call I have. The state health departments, all the local health departments in the state have call twice a week. It's the number one, you know, let's work on that. And the state's working on, as far as that's the PCR test that takes a long time to get. I think the state said it's 75% of the time they're within 72 hours. You know, the testing is being ramped up. I mean, if you look at the state's dashboard, we were averaging, you know, 10,000, they're doing 20,000 plus tests a day. So that's quite a big number. Falmouth's averaging every 2 weeks about 1,300 tests. So that's about 650 people per week that are obtaining a test in Falmouth, according to the state. Because I only see positive. So I rely on the state's data every week to update, to tell me what's going on as far as testing numbers. I don't receive negative test results. And what was your third part of that question?
I guess give us a sense of that. I hear that as the concrete actual number, but how good is that? What are we really capturing out there that's asymptomatic?
Well, it's imperfect. We're a whole magnitude better than we were even 2 months ago. Obviously, it needs to get better. What we need is something that's rapid, cheap, and reliable is what we really need. And we're getting there. I mean, Yale University had the study that they've been working on some stuff, and different places and entities are working on it. Now, what you have now are 3 types of tests. Okay? The PCR test is the gold standard. That's the one that you get at the hospital with the swab test that goes very far up your nose, and it takes a little bit of time. And what that's trying to detect, what that does detect is viral load. It detects DNA. It tells you the virus is in you. Okay. The second test is an antigen test, which tells you that you have there's a current infection, that you're producing an antigen to fight it. The accuracy is not the same. So the gold standard is the PCR, because there's false negative and false positives. Of course, false negatives being much worse than false positives. But it is relatively cheap, not that cheap, but it's also rapid. And so that's what you hear about the place in Dennis that does the Caremark, that does the rapid testing. And then the third one is the antibody test, which just tells you that there's a past infection. You could have had it in February, you could have had it in March. It's really not that accurate to tell you that you have a current infection, because it's just checking that your blood, which usually takes a couple of weeks to build the antibodies. It's not good for active infections. That's what we have now for testing. That's going to change as time progresses. Also, I heard from a state call this week that they're going to use, if you remember the long-term, in some of the articles, if you were watching TV back then, I'm sure you were, is that the state was going to use the, what did they use to do the testing at the long-term care? National Guard. So the National Guard came out and did long-term care testing. Do you guys remember that back in the spring? I think they're ramping that up to do that for schools. So if they have an issue with schools, they'll be able to do that, a quick test, get everybody down, and that's a PCR test. So that's the real deal. So those types of things are coming down the line as we speak, you know. So we're all just working on that as a priority right now. So I'm sorry it's a long-winded explanation, but is the testing perfect? No. The test that's perfect takes a long time. That's the problem. Okay, the PCR test.
Other questions for Scott? While you're thinking, I have one question. So I remember in previous presentations, you sort of delineated between the number of positive cases that we had and the number that you knew were already in a long-term care facility. Yep. So you said that we've had, I think you said 4 cases since early August. Mm-hmm. Do you then sort of push a couple of those aside when you're talking about the community at large because some of them are in a long-term care, or are they not, or can you even tell us?
No, I mean, I usually try to break them down when I do that FC Tech presentation. The number of 241 includes all long-term care. The number that I gave you, the 241, is right off of Maven. It counts every single person that tested a confirmed case. And what about the cases, the recent cases, the 4 most recent ones that we've had? It's okay if you can't tell me. I don't want to Well, from HIPAA, it's a little hard, but yeah, I mean, a couple of them were from. I think one was since it didn't seem to the test that's given at the hospital prior to having surgery is very sensitive, for what I've been told. So you always want to err on the side of tests to be false positive. Obviously, false negatives are horrible. You want your test or design your test kit to be false, to be on false positive. A couple of them were people going in for surgery and were asymptomatic, but were surprised, very surprised because of the limited activity. That tends to lean towards maybe a false positive, you know, and one was obtained out of town, out of state actually. So, I mean, 3 out of the 4, that's what we have. Okay. But that's, I mean, I'm asking because But Kelly, that's subject to change. I mean, for me today, that things are great. You know, like I told Sam Patterson, one of the selectmen, right? He was thanking me for the counts being as low as they were. And I don't want credit for the counts being low, nor do I want to be blamed when the counts are high, right? So, I mean, I can only do what I can do. I mean, the reason why our counts have been what they are is this town's done a really good job about the social distancing and the mask wearing. I mean, it's really the public, you know, policing itself. You know, we do as much policing as we can, but we only have so many people chasing so many complaints. But it's really the people doing the good job with it. And, you know, that's where we're at. And another positive thing, and, you know, take this with a grain of salt. It's just anecdotal. It's just me looking at the Maven cases, okay? That since we've gotten into the mask wearing and the social distancing, the outcomes on the cases have been a lot better, okay? If you look at the hospitalizations at the 0, I mean, if you guys do you guys actually look at the state dashboard? I'm like a junkie with it. I think 5 years from now, it's still going to be going on. Hopefully not for that reason, but you notice that the hospitalizations have been lower, at least in Falmouth, you know, in our area. I think, and just me, is the mask wearing and the social distancing, even if you do obtain the dose, it's about your initial viral load. Now, you can ask Dr. Parkinson. He's a clinician. I am not. But your initial viral load seems to be very dependent on how your outcome is. So if your viral load's low, meaning you obtained a little bit because you had the social distancing and the mask wearing, it does seem to appear that I get a lot more asymptomatic cases. We're better at, and plus we're just better at it. The last 15 people at the local long-term care facility were all asymptomatic. That's amazing to me. If you would have told me that in April or May, I would have told you there's no way. I mean, normally the mortality was 15%, 20%. So is that because of what? I mean, you know, the one thing that we do know in the last several months, we've gotten a lot of, you know, religion over the mask wearing and the social distancing, and it seems to have an effect because when I do get a case, it does appear to be less, even at any age. Now, some of it's because we've had some younger kids get it, but some of it have been people in their 70s and their 60s. And so, I mean, I'm encouraged by it. You know, that's always subject to change, but, you know, that's what I'm seeing.
So Scott, I know now everyone's got questions. Lisa, you go ahead.
First of all, thank you, Scott, for all the information. I think it's crucial that we truly understand the number of cases, even just the 4 cases here in August and being at 0.5%, so 5 tests per 1,000. And And so your opinion, and you just got done saying, is that, you know, Falmouth has done a great job. Everyone's wearing their masks. We're doing social distancing. And so obviously the burning question is it safe to open the schools and send the kids in the schools, send the teachers in the schools if we maintain the proper habits that we have been so far in Falmouth? I just would like your opinion on that.
Well, again, I'm not a clinician, so I'm going to tell you to follow the state guidance. I've been telling people to follow the state guidance. And what does the state guidance say if you're in the green? It says it does say that. And Dr. Parkinson's probably a better person to ask that question because so, but what was your other part of the question?
No, there's just the one part, whether or not it was safe to send the children and the teachers back to school.
Yeah, I think it's best for him. But in terms of, again, the case counts as, I guess you're best off just asking.
I'm sure we will. We will. John, did you have a question for Scott before?
Yeah, for Scott, just to follow up to the long-term facility discussion. So it's my understanding also, and I think it's an important point, is that a lot of the numbers too, once someone is transferred from a long-term facility to the hospital, you were talking about the outcomes. Once they're in the hospital, umbrella, if you will, they're no longer considered, under the long term. But if you looked at the big snapshot, they really were in that long-term facility. I just wanted to share that.
Yeah. So what happens is when we have what we do is what the VNA does is create a cluster. So it's assigned its own number. It'll be a long-term care cluster. That person, regardless of where they pass away or whether they get hospitalized, will still be counted under that cluster number. So it would still be under that cluster for that nursing facility.
Okay, thank you.
And Scott, I did have one last question that didn't get asked yet. And I remember, I think it was the last time you were here, you were saying that the antigen tests weren't popping up in Mavis as a positive, and that was a concern that you had, and giving us accurate.
Yeah, you were breaking up, but I think I know what you were saying. Yeah. Well, I think I can answer the question, even though I got the only part of it because you were breaking up a little bit. Yeah. All right. So the antigen test is considered a probable, not a confirmed case. So probables are still contact traced. Can everybody hear me? Okay.
Yes.
You contact trace the probables. So we're going to contact trace them like the confirmed. So we're not ignoring them if that's what the question was. We're going to treat them like a confirmed case. Whether they count towards our number or not is the state's decision. They determine what's confirmed. The probables will be the antigen test and any other new science that comes around, unless they are given the gold standard that the PCR test is having.
Thank you.
So I hope that answers your question.
That was great. Yeah, that's what I was, and I'm sorry if I'm choppy. I'm turning my video off for a little bit because I'm having some internet issues. I got to go kick all my kids off the Wi-Fi, and then I'll hopefully be able to bring my internet back or my video back up. Any last questions for Scott?
And you guys feel free to email me a question if you want one.
Thank you. Thank you. We really appreciate it. And we definitely appreciate you taking the time to come to us again. We rely so heavily on the information that you're able to provide us, and we're very appreciative. Thank you so much.
Scott, I'm going to ask you to hang out for a little bit, just as the conversation goes, but Kelly, do you want to introduce our next guest?
I do. So since we already gave him, Lisa already gave him a plug. He already knows the question's coming to him. So we also, next on our agenda, have Dr. Parkinson with us, our district physician, to give us a little bit of his insight and hopefully be able to answer a couple questions.
Hi,
Thanks
everyone.
for joining us, Dr. Parkinson.
You can hear me okay?
You sound great.
Okay. So, yeah, as with Scott, I think probably best to make my speaking brief, and the question period is really where it's at. But, I've been thinking of this sort of in three tiers. And, the first tier is all the great work that so many people have done within the schools to try and make the physical plant as safe as it can, to do what we can with the numbers of children, to do what we can with the spaces, and that will continue to translate to what's actually going on in the building with how the kids do it wearing masks and how they do it staying distance and how we do it hand washing. And that's going to require ongoing vigilance. The second part is, Scott was alluding to somewhat with the testing. And I don't think that it's going to come as a surprise to anybody to say that our ability to respond if there are issues in the school is going to be dependent on the availability of rapid turnaround for testing. That is somewhat of a challenge because it's not entirely within our control. As providers, all of you as, members of the school community, we don't get to say how quickly we get test results. And there's no question that anybody who's talking to anyone that has any pull in this regard, whether it's the governor or your state representative or anyone, within the DPH, the more we can get, the sooner we can get to a situation where we can get rapid turnaround of testing, the same day or the next day, absolutely the better we're going to do. And until we get that, we have one arm tied behind our back, and that's what we have to deal with. The third part is, everyone kind of looking at the school and saying, what are you doing at the school? And I turn that around to the community and say, what are we all doing in the community? Because what happens in the community ultimately will dictate what happens in the schools. If the community does its part and walks the right direction down the grocery store aisle and wears their masks when they're out in public and wash their hands and limits the number of people and we keep the big gatherings away, then our burden in the community will be lower, especially as we move out of tourist season. And if we can do that, as I said the other day, if the sun is shining, we don't have to worry about our raincoat. But if there's a hurricane, the best raincoat in the world is going to not give us the kind of protection we want. And so I really want to encourage members of the community to, do those three things, to keep their social distance, to wear their mask, to wash their hands, and also for individual parents out there, if your child is sick, to understand that as difficult as it is, you have to stay home. And the more we can do that and work together, then it's just going to keep everybody safer. And if we do that, I think we can do it. How well we're able to do it is going to depend on how well everybody does at that.
Thank you. So Lisa, I'll start with you because you already asked a question that got bumped over to Dr. Parkinson.
Well, I think he kind of just answered it for me.
I think so too, but I didn't want to.
Yeah, no, and thank you again for joining us as well. But, both you and Scott have done such a great job of giving us information on, kind of where we stand as a community. I agree. I am thrilled when I can drive down Main Street and see everybody out wearing masks. I think as a community, we've done a really great job with that. There's a lot of concern from parents, a lot of concern from teachers, even concern from children. And, I think being able to hear that if we do all these things properly, that we would be okay if we were in school. I think that's really, what everyone needs to hear. And if not, what is the next step? Your analogy with a raincoat and a hurricane is really, it's dead on. So I think that you've pretty much answered my question, but I think, kind of stating it once again, if we do it right, we can actually pull this off.
Yeah, the other thing is just maintaining our vigilance about it. I don't want anyone to get lulled into a false sense of security about it. Just moving to a little lighter spot here, so I'm not in the dark. It's what you said is absolutely true. That I think we can do this if we work together. If we continue to do the little things well, the big things will take care of themselves.
Thank you.
Terri, go ahead.
So I imagine people are going to be really nervous about maintaining all the 6 feet and the everything. So if people slip up, is that okay? I mean, I'm trying to find a way to make things not be so prison-like. I mean, the feeling of that. So suppose kids bump into each other in the hallways or things like that. Right. Is that very dangerous?
Right. So none of us are perfect, right? And you know, preparing for one of the meetings, you know, it occurred to me I was uncharacteristically, you know, a little nervous about it. And so I sat down and I kind of got all my ducks in a row. And then I realized the reason I wasn't feeling, you know, as comfortable about it was because I hadn't done all my homework yet. And once I got everything settled and I knew that, okay, if this, then that, etc., all of a sudden I felt comfortable again. And I think the same is in the schools. You know, if as a school community we can do our work, then we can convey that to the school nurses. They can convey that to the teachers. When the teachers feel more comfortable, they can convey it to the students. When the, you know, and it's all going to go from there. And so, sure, you know, and you know, God bless, you know, someone like you that you don't want to make even one little slip up, you know, and those things are just part of the reality of being in a school. This is not an intensive care where there's a protocol for, you know, taking on and putting off of gowns, and where you are trained and drilled in how to never make that mistake so that you don't have an issue. And we have to, you know, we have to realize that in the greater community, there's more leeway than that.
So it will help if, like in those professional development days before the kids get there, the nurses will give what you just said, that line of command that you just said, you think it'll be more comfortable.
People need to know what we're asking of them. They need to have a chance to rehearse it. So I think those professional development days are important. And I'm hoping that we're even going to get a little bit of a chance to do some mock, you know, situations, so that, you know, because the teacher's got to feel comfortable saying, okay, I have a child that needs to be dismissed, you know, what's going to happen? And I can tell you, and anybody who's been in the community since this started, and as, you know, as pediatric offices, we never entirely slowed down. We slowed down, we never entirely stopped. That the first few days, the first week, was very, you know, was a lot. It's a lot to get your head around. And everything gives you a headache because you're doing it for the first time. It's not a routine. And then now, a few months later, it's like, okay, this is what we do. And, you know, it's become our new normal. And so the more chance that people get to try out, and even having somewhat of a summer program, you know, the nurses have had some, you know, trial runs with a much smaller group of what to do. And the more we get experience with it. And I think right now it's so hard because all the community can do is anticipate. And once we get up and get running and say, hey, okay, we're doing okay, I think we'll get some confidence.
Thank you.
Any other questions for Dr. Parkinson? Leah.
Hi, Dr. Parkinson. Thank you for being here. I guess my question is, because, you know, when we started this journey, the Commissioner of Education put out information saying that children had a smaller viral load than adults. And then research came out around 10 and up. And so my question is, where do we stand right now on research around children carrying the virus? And I guess I have another part of this question is, where do we stand on children being tested? Because I know that adults have been able to get tested and we're able to go through a process when we're asymptomatic and still get tested. But what about children? Do we have enough data on that?
Sure.
Okay.
I think there's two, I'm glad you asked that, because I think there's two really important points. The first point is that we know absolutely that this is a much milder illness in children than it is in adults. And, you know, especially as adults get older. And because of that, you know, when somebody asks me, is it safe for my child to go back to live school? My answer always begins, who else is in the child's life? Because I'm much more worried about the grandparents or the person with the underlying condition than I am in terms of the likelihood of them getting seriously sick than I am a child. Even children with complicated medical conditions are significantly less likely to get badly sick from COVID than adults are. And for children, the flu is always is a more serious illness than COVID is. And so I think to give something people know and are familiar with, would you feel comfortable sending your child to school with this level of flu? And if the answer is yes, then that gives you some reassurance about COVID. Now, the issue about children and their ability to transmit the illness, I think is being overplayed. And the reason I say that is we know that children are less likely to show symptoms than adults. That's clear. We know that it's possible for people without symptoms to transmit the illness. That's clear. We don't know how much that changes with your age. We don't clearly know. And so I think we should assume that it's possible for somebody to transmit the illness if they don't have symptoms. And that's where we get right back to where we started with the hand washing and the masks and the social distancing. If we do those things well, then the question of how contagious children are becomes much less important.
So then I had that second part about testing.
Okay, so testing, testing is available for children. I think testing for children and testing for adults is in the same boat. Yes, we're testing children without symptoms on a regular basis. All the offices are. It's still being done piecemeal, through various labs we can send it out to, going to the hospital, going to, outpatient clinics. It's going to get better slowly in a piecemeal fashion as individual offices are going to start to get their own testing equipment moving into the fall, but the timing of that, is to be determined. Until there's a coordinated system, it's still going to be piecemeal, but we're doing tests every day, and all the offices are.
Sorry, Leah, are you all set?
No, yeah, I'm good.
Okay. John, did I see your hand go up?
Yeah, just in looking to move forward, I think that, when we have scenarios that may come up and we can kind of work through and practice through them, I think it's important to recall that, and for folks themselves that, to remember that, their own skill sets, the teachers, the support, and the custodial staff all have the skill sets that are already, for years of experience. And then now we're just adding the mechanism of how to implement those skill sets in the COVID dynamic, like with cleaning, best practices, and signage. And any way we can utilize Dr. Parkinson on all of those items to say, the items that people already know, here's what I would normally do. And then any way we can bridge that, with the mechanism now, how to do that, it would be very helpful.
Right. There's nobody better to teach kids how to do this than teachers. And of course, the teachers have to be taught themselves.
Dr. Parkinson, we're losing your audio.
Losing my audio.
Oh, there we go. Maybe you just had your thumb over it.
Oh, okay. So there's no better teacher than a teacher. The nurses have to teach the teachers, but once they're taught, and again, once they're taught and feel comfortable. I think in novel situations, I think you hit the nail on the head. We always start with, I don't know how to do this. But if we can start with, what do I know how to do? And how can I take a process that I already know and then put a new wrinkle on it, is a much, it's a much more, it's much easier to get your head around than starting from scratch.
Any other, Lori?
Yeah, so I actually have a couple different things here that we were talking about. I'm going to stick with the testing for just a second. I'm going to ask Scott to talk about, we are attending a meeting tomorrow night. Scott, you want to just talk a little bit about that since we're on the testing?
Yeah, I mean, I'm working towards trying to get some sort of a testing regime available. It has to be the right test, okay? Not an antibody test per se, because we don't need to know whether somebody had a previous infection. So it has to be the right sort of setup. So all the different health agents and docs and different entities are working towards some sort of a resolution on it. So, I mean, it's not like we haven't ignored that sort of testing part of it, but it has to be the right test, and it has to be something that's going to work for us, not necessarily just using the word tests, you know, and what does it mean? So, we're working on that part. So,
Can I just ask for clarification, because I'm not sure I actually understood. So are we looking into trying to have some type of testing system that is for Falmouth Public Schools so that we can,
well,
is that what you're, I don't want to put words in your mouth.
Yeah, if it's something that can work out, like, ordering a bunch of, tests that aren't really accurate doesn't help either, right? So It has to be the right regime, and I'm not shy to say I'll steal the best ideas available from other places. I'm not bashful. So, I mean, I'd like to, and it's not, I just wanted to let the public know that we're not, and you guys know that we're not ignoring sort of, the inavailability of good testing and so forth. So, we are working towards something of that nature.
That's
don't
great.
have a time frame now.
Just to clarify about the testing, or about the meeting tomorrow night, Dr. Parkinson, Scott, Julian, Suso, myself, it's a Cape-wide meeting. And it's a joint superintendent's town meeting with our physicians and health agents. So it is I think we're going to be looking into what are some solutions, I would say, that we might be able to look at and what's available. So we'll learn more tomorrow night. But yes, I think to Scott's point, that's why I wanted him to speak to it, was, that we're not ignoring it, that we're trying to learn as much as possible and see what's going to be best for the schools.
And I think it's worth pointing out, too, the level of cooperation that's going on across the Cape. Obviously, the school superintendents have always spoken to one another, and the school nurses have been very good to speaking to one another, but that is increasing in the amount that it's being done. The school physicians are now speaking to one another more often, and all three groups are meeting together. And so that is... those things can only help. We're trying to make it so that somebody who works in Barnstable but lives in Falmouth and their kids go to Upper Cape or what have you, that there's some degree of consistency.
Thank you. Leah.
Just a clarifying question again around the testing piece. So is this actually thinking that the testing would take place in the schools, and that there would this be symptomatic testing, or I'm sorry, I'm just.
I think it's premature to
yeah, I was going to say the same thing.
That the state has made available a mobile testing unit, or is going to have available a mobile testing unit for what they call clusters. They didn't define exactly what a cluster is. You don't really want to be that person that qualifies for that. In terms of what else is available, I think it's preliminary to say.
Lisa.
You had mentioned earlier before that your biggest concern was asking who are they living with at home. So if we have some children that are going to come to school and they have elderly parents or their grandparents are living in their home, are you suggesting that opting for the remote learning would be the better choice for that particular family? Or do you still feel that as long as they are, social distancing and wearing the mask, that they would be okay in that situation for those families that have perhaps older parents or grandparents living in the homes?
So that's a very challenging question, and I think that, as with all of those questions, it's going to be a decision that each family has to make of their own accord. If somebody in my practice has a medically fragile child, they'll be discussing it with us. If someone that's out there watching is medically fragile, especially older, etc., having children, grandchildren or what have you in school at any time is a potential risk to their health. Of course, the higher the burden of illness in the community at the time that it happens, the more risk is going to be. So I think the short answer is that if somebody is in that situation, they'd be well advised to reach out to their healthcare provider and say, hey, do you think it's safe for my grandchildren to be in school and seeing me where we're at right now?
Thank you.
Any last questions Lori, go ahead, sorry.
I have one more. So I just wanted to, we just got the state regulation from the Department of Health that all school-age students, kindergarten through 12th, will be required to have the flu shot. And Dr. Parkinson, I just wanted you to speak to that a little bit, since this was a recent development. We haven't been able to talk about it. Could you kind of address, in what ways why that's good or not good? I mean,
right. So I'm a pediatrician. Any good vaccine I'm going to think is a great thing, right? And this really is a good decision. And the reason for that, there's a few. In the same way that we want to minimize exposure of our kids to coronavirus, we want to minimize their exposure to the flu. As I alluded to earlier, the flu is a more serious illness for most children than COVID-19 is. Children die every year of the flu. And so everyone getting a flu vaccine makes sense. And, you'll hear people say, well, my kids have never gotten the vaccine, they've never gotten the flu. When you look at it under a microscope like that, that may be true. But it's absolutely certain that at the community level, communities where there's a higher level of flu immunization have a lower burden of illness. Then on top of that, you add what happens when somebody is coughing and has a fever. You're not going to know if it's the flu or if it's COVID-19. That's going to put a lot more stress on the schools, especially the school nurses. And there's going to be a lot more dismissals. And then you worry about maybe if somebody has the flu, they're coughing more. Well, what if they had picked up COVID-19 as well? Their chances of spreading that are going to be higher. So there's several layers of reasons why this, I believe Massachusetts was the first state in the country to do this. And I think it's really a very good decision.
Thank you. Bill, I think I saw your hand up, and then Andrea.
Yes. We mentioned testing for children over and over and over. And obviously, it would be nice to see a rapid testing turnaround time for kids if they need to be tested. But I'm also concerned about the testing for adults in the buildings, whether it be administrators, teachers, cafeteria workers, et cetera, et cetera, et cetera. What is the responsibility there for the school district or for the health community? Because I think those are important entities when we're dealing with the educational process.
Well, in terms of the responsibilities, I'd probably defer that to Lori. But in terms of the healthcare part of it, I'm glad you brought it up because based on everything that we've discussed this evening, and also on you know, everything that all of you already know about this illness, you know, the keeping the staff healthy is very important. So again, as you know, specifically as far as the testing, I don't think there's any difference in the community as it stands right now between an adult getting a test and a child getting a test. Right now, if you need a test, you go to your provider, or you go to a clinic, or you go to the site and you get tested. The reason that improved testing, though, even among children or among adults, everybody wins, right? Because if you identify illness sooner, you get that person out of the circulation sooner, and then you limit their spread. And so the testing issue per se it's not really an adult versus a child thing. It's, of course, if there's more readily available and quicker turnaround testing available, absolutely for adults, it's going to be a win.
Andrea, I think you were next.
Yes, thank you, Dr. Parkinson. I wanted to follow up on the new regulations on flu vaccines for all K-12 students. And could you just let the community know, because I'm sure people are concerned about how that's going to happen between now and the end of the year. You know, students who have already had well visits, maybe people who do not have adequate health insurance. How are we going to help to ensure that that happens for all of our students?
And I'm glad you asked that as well, because as with so many of these things, the desired outcome is dependent on how the little steps that are required to get that done. As you can imagine, or anyone who's, you know, brought it, you know, gone to get a flu shot, it's you know, that's a lot of people to immunize, and it's going to require an increased effort on everybody's part to get that done. Now, December 31st was when it is required by, and that's part, I'm sure that date was chosen to give some time to do things. You have to keep in mind that when you're immunizing a lot of kids for the flu, you can't have 100 kids standing around to get that, because it defeats the purpose. So people are looking into, including in our own office, you know, we're going to be doing drive-through clinics, and we're, you know, there's going to be all kinds of things done. You know, if you want to give a pediatric office a challenge them to immunize more people. They'll take that challenge all day long. And I'm sure that you know, for adults, that's where you know, adults have more availability of the pharmacy flu tests, maybe less availability at their primary care for it. I would say that you know, I would caution everyone about calling tomorrow to get their flu vaccine, because I can tell you, speaking personally, the state hasn't delivered it yet. And so we don't want to get into a situation like we had with the swine flu, where President Obama said, get your swine flu shot, and then they didn't deliver it for another month. So please don't overload the switchboards tomorrow. My office will kill me. But soon we will have the vaccine, and it's just going to take a lot of regular work. And like I say, people are quite prepared to do it.
Dr. Parkinson, can I follow up on Andrea's question and ask whether or not the flu vaccine is covered under Vaccines for Children? So is it free even if they don't have insurance?
Oh, good question. Even if flu vaccine is provided by the state.
Okay.
I'd have to look back.
Scott knows.
I don't know the complete answer. The VNA gets an allotment for each town. There's an allotment going through now. Obviously, since the requirement, we're going to need to increase the allotment. So I've been working with the VNA to increase it for those that are uninsured. So there's a certain amount that comes in every year. You know, the world of flu shots has changed. You used to either get it at your doctor's office or you come to the big town of Falmouth Flu Clinic. You remember? Now you can get it kind of everywhere. So the flu clinics at health departments have gone down to where I was giving it back to the state and giving it to the VNA because I had so few people come to our clinics. But now we have to ramp it back up. So now we got to look at getting some more vaccines. And that's what I'm going to call into the VNA today, actually, to see if we can increase their allotment of vaccines, especially for those that are uninsured. So working on our end too. But the primary place you're going to get it would be your pediatrician's office for most of us.
And I do think that is worth once vaccine is available. I think it's, possibly working with the media to let people know where it is available and how they go about getting it. And presumably they're going to need an appointment to do it because, just of social distancing and not overcrowding places. But that's something I can put on my list to make sure that word gets out once we have it clarified.
Scott?
And for adults, what we're going to do this year is all the towns are getting together and doing a large vaccination clinic in Barnstable at the complex. So we're still working on it. I think it's going to be September 26th. So I'm going to be posting that on our website too, and that'll be a drive-through. So we're looking at doing a big, large regional clinic for the older folks. And so some of you on this on the call or listening now, that's going to be, I'll be posting that in the next day or two too. So there'll be that avenue as well.
And is that 18 and up?
Yeah, that one's going to be an adult one.
Okay. Yeah. Thank you. Were there any other questions for Dr. Parkinson? Oh, sorry. I almost missed you, Andrea.
No, Kelly, I was just, I noticed there's a hand raised for participants, and I didn't know if you were going to.
I think that really this is intended for the school committee because the public or at least to the staff had their opportunity to ask many questions.
Okay.
Scott.
If you want me to answer one, you just email scott.mcgann@falmouthma.gov.
I'm hesitant to put our doctors and health agent on the spot to answer potentially
I'm on the spot every day. So people ask me 100 questions a day. So if you want to ask me a question, you're always free to call the health department. I get that all day long. Don't mind answering it.
That's pretty much what we do all day as well.
Kelly, can I ask a follow-up question just about the flu shot? Okay. So I guess this is more directed towards Lori. So we're going to have some families who aren't going to be able to access these drive-through clinics and things. Is there thought about offering something at the schools where we'd be able to provide the flu shot while the kids are there, while we have them? Oh, and Scott has the answer to that. Is that right?
I wouldn't say I have the answer. I mean,
okay.
We can do it a couple of different ways. And obviously, it's a communicable disease, so we're not going to have a big clinic at Morse Pond School, right? We're not going to, Dr. Parkinson just mentioned it. Maybe it might be an appointment set up with the VNA or something of that nature for certain cases that, may not have access otherwise, right? So they can schedule it with the VNA directly.
Well, I think that's where my concern is that we might have some families that can't access, besides their kids are in school, but besides that, it would be hard for the kids to get the vaccine. And my fear is that we're actually, Lori, from what I understand around this memo from the commissioner, is that we can't have any child who's not vaccinated or doesn't have a medical exemption or a religious exemption, right?
Yes, that
in
is
our schools.
31st. But I will say that Dr. Woodward, it's on her list. She's working with the nurses and Dr. Parkinson to see how we can make sure that everyone that can have access that will. So we will help them. But it's been on her radar since that memo came out last week.
So Lori, I'm actually, since Dr. Parkinson and Scott again said that they're willing to answer a question and we only have one, can you promote S-Smile so they can ask their question of either one of them? I'm not sure who it's for. And in the meantime, John, did you have something while we're waiting?
Yeah, no, just a comment. At WACH.com, there was a story several hours ago that said flu shots are available at more than 400 CVS pharmacies and 65-minute clinics in Massachusetts to help families, do the return to school thing. So I'm sure that'll be a resource. in addition to other folks' locations too.
Thank you. I'm not sure of your name, S. Smile, but if you can introduce yourself for the record, and then go ahead and ask your question. Oh, and you're muted.
I've noticed that hand was up since the meeting began.
Okay, well, maybe they've left us. Yeah, I think that was, I think you might be right, Terry. I had actually turned off my, my participant screen, so I hadn't seen that one. So, all right, well, we put you on the hook and then you didn't have to answer anything. So, any last questions?
You still get full credit.
Absolutely, absolutely. Any last questions? So thank you so much to both of you guys for joining us. And, we really appreciate all of the input and all of your feedback. And Dr. Parkinson, one of your comments really sticks with me that, it's the fear of the unknown, and that once it's not unknown anymore, maybe it won't be so fearful. That's the hope. So I'm taking that away. That's my takeaway tonight. So thank you guys, and stay well, and I'm sure we'll have you back soon.
Thank you.
I'll try to get my lighting better for the next.
I have the same problem. I know. I have the same problem. So next on our agenda is Lori Andrade from FE. Where is? Do I see her? From FEA. Let me promote Lori. There she is. Hi, Lori. Can you hear us? There she is.
Yes, I can. Can you hear me?
Yep, we're all set. Thanks for joining us.
Thank you for the invite.
Absolutely.
And good evening, everybody. First, I did want to thank the school committee member who requested Falmouth Educators Association, which is also called FEA, be put on the agenda, and the invite that you, Chairperson Welch, extended to us. My name, again, is Lori Andrade, and I am proud to be the Falmouth Educators Association president, the executive officer of the association who represents the association as a delegate before the public personally, among other duties respective to the position. FEA membership is currently around 450 members strong. It includes all permanent teachers, for example, general education teachers, special education teachers, and related service providers like OT/PT, speech language, school adjustment counselors, English language learning teachers. It also includes school building administrators with the exception of principals. It includes teacher assistants, but not one-on-ones. And it includes our wonderful nurses. In this role, I am representing the association publicly to state for the record that FEA leadership and FEA members want nothing more than to be physically in school buildings with all of the students, but only when it's safe for everyone. I want to acknowledge the planning and work that everyone has put into being part of the process. FEA is hopeful that this presentation will be the update that was requested of us, and that the transparency of such does not make us divisive. Whatever comes to fruition, I remain positive that honesty, collegiality, and collaboration with an open exchange of ideas are desired, supported, and promoted. None of us will please everyone, but we do need to presume positive intentions to maintain this open communication. On that, I agree with Dr. Parkinson in that we all need to work together on this to make it work. He also said, and if they do it right, they can pull it off. And another quote, we can teach teachers how to do it, and they'll be able to do it once they're comfortable. And teachers are the best teachers. And I couldn't agree more. Teachers have a passion. We went to school. We studied hard. We received certificates. We renewed what were lifetime licenses to teach, if people can remember back that far. We did our student teaching with the hopes of someday having a fulfilling, enriching career where we could make a difference in the life of students, families, and the community, whether as a teacher, an assistant, a school-based administrator, or a nurse. We learned about and practiced instructional best practices because we care, like differentiation, small group instruction, maker spaces, theater productions, concerts, hands-on activities, and the application of STEM activities. For those of us that have been around for a long time, You know what the pendulum swing is, right? You know what it's like. That which is old is new again. We have learned to pivot from one reading or math program or set of textbooks or materials to another. We have participated in professional development almost every half day and scheduled full days for years. We have elected to attend and even created professional development activities for each other. We have supported, bought, and or donated to our families and students who are less fortunate. We have volunteered at and supported the many school functions hosted by the various PTOs and or community partners. We have created and held curriculum nights and art shows and spaghetti dinners, right? And field days and awards nights and sporting events and enrichment activities and after school clubs, and have been Alice trained in the event of an intruder, where we are responsible for students' very lives because we have been acknowledged as being responsible for students' physical, social, and emotional well-being. And we teach. And that teaching and the environment will not be the same. FEA wants families and students to understand that teaching and in-school experiences will be very different for the students and staff that work with them. The multitude of safety protocols will impact the students' entire day at school. All of their interactions with the adults and other children in school will be affected. FEA members represent 40 towns where we reside. So what happens here affects more than just Falmouth. I did ask if I could share my screen. I did have members who had pictures that they wanted to share of their classrooms.
Lori, I think you should be able to.
Thank you. Just wanted to make sure before I clicked away.
Absolutely.
Because you know, you look like you're staring into the great abyss. And so here are some statements that we got and some pictures. These were from Mullen Hall. Warm water is not available at most bathroom sinks. This becomes increasingly evident in winter. Lack of ventilation in our bathrooms is a concern, especially as aerosols linger. Opportunities for circulation of outside air in the classrooms also is worrisome. Sorry, I was looking to enlarge the print. As our windows push open from the bottom, maybe allowing for 8 inches. On the ground floor, there's not a chance of catching a breeze. The classrooms are going to be packed to capacity with desks 6 feet apart. I have trouble envisioning pathways for children to access the bathroom, cubbies, and outside door without the same few children being passed by the other members of their cohort multiple times a day. The risk for these children increases in kindergarten and first grade, where mask wearing is only suggested currently. This was sent in by another teacher. This is a photo of my classroom sink. A dehumidifier on wheels on the edge of a sink counter with a garden hose running into the sink. The cord is stretched to the only outlet on that wall. I don't even know what to say about this, but it is not okay. This classroom is extremely muggy and musty, and the windows only slant open a few windows. Also, the soap dispenser is not even attached to the wall. I don't even have a room or an office from which to work. I worked last year in a grade 1 team room when it was available and when I wasn't, which was Friday banking and garden club meetings, alternate timeout room, and a mentoring room, and an alternate counseling room, and an alternate meeting room, etc. I worked out of the common area called the grade 1 pod, basically the lobby outside the first grade bathroom. I don't anticipate any change in that condition in terms of getting an office space this year. The pod is the hub of classes passing to all specials, to lunch, recess, and all first graders who need the bathroom or a drink. In other words, it's Grand Central. I have more stories I would be willing to share. I have here some more pictures of a sink. People had a concern. It doesn't have warm water. The water is frigid. That one I can't read, so I'm not going to bother sharing, but I do have some other pictures. Hopefully it's bigger to see, but if the committee would like them, I can send them to them later. This was a picture of, on Monday, somebody went around the building and sent 4 separate pictures. And this is one of the new HVAC systems. And you can see on Monday, the temperature is 84.7 in one classroom. And that's with no other bodies but one teacher. Here you can see this is where a desk has been placed. You can see that this is the door to go outside. This student desk is on the doormat with which to open. The door actually doesn't open all the way, and that was a concern to this teacher in their classroom setup. But that is how many are needed to get how many kids there are. This is another room at the same school. The temperature is 81.4. The 70 degrees you keep seeing is what it's set at, although it's not an air conditioner. That's what the temp was set at for the room, and it might be a default. This room, the person actually manually turned it down in their room to 68, but you can see that it's still 80.3 degrees. FEA members are passionate. We care about the lives and welfare of the students, whether we are a seasoned veteran or a newer teacher without professional status. None of us could have foreseen the teaching and learning environment we are in today during a global pandemic. Perhaps you were one of the hundreds of community members that saw the Cape and Islands, Massachusetts Education Action Network Day of Action last Wednesday that took place Cape-wide, or read about it in all of the local and regional newspapers in print or online. I would like to clarify any misperceptions. It was not a protest. I repeat, it was not a protest. It was a show of support for educators' stance that we return to school buildings in person when it is safe for everyone. FEA does not believe that is the case. Our big safety concern are the HVAC systems. The effective filtration and proper circulation of air in every classroom at each of the 7 schools is high on our list of priorities. We have asked for a detailed reporting of the inspections of the HVAC units by a vendor that has been approved by the Department of Ed prior to any staff members or students spending time in the buildings. I, as president, created and signed a joint statement that I respectfully requested Superintendent Duerr to sign. It was one request that did involve money, but as we have heard, there is ample money available. What I received back from Superintendent Duerr to my one item that required hiring someone to complete the job, which I presume to be well-intentioned, was a different joint statement that included a lengthy list of additional safety items for me to commit to on behalf of all 450 plus members. The list included: 1, safe schools will require a commitment from all of our staff to follow the health and safety guidelines. Here was my pause. The guidelines change frequently, and I will not commit to a fluid document where our concerns are at times seemingly rejected, minimized, and devalued. More about the term rejected to come, but HVAC systems are under central office's control. Number 2, all staff will commit to wear masks and additional PPE, wash hands, and use sanitizer frequently. I cannot commit adherence to a policy that pertains to someone else's actions for which I do not control. HVAC systems are under central office's control. 3, stay 3 to 6 feet of distance from others and when less than 3 feet is necessary. In our proposal, we are bargaining. We are not relying on DESI's and Commissioner Riley's guidance, but CDC guidelines to be at least 6 feet apart. Additionally, the way classrooms were set up, the directive was to measure 6 feet from the smart board or the teaching space that's in the front of the room to the closest student's chairs, which, if you count the space a human body takes up when pressed against the board, is already less than 6 feet. And it assumes a teacher will not lean forward or try to use the board, which will now be less than 6 feet of distance. Also, we have learned that the desks were not actually used to measure the student bubbles. The measured space were from the legs of one chair to the adjacent chairs, and that was the baseline for the measurement. That leaves less than 6 feet of distance between the teacher and the students if the teacher leaves that zone. I could not logically and logistically commit to this either, but HVAC systems are under central office's control. 4, teach and reinforce new routines to students. I cannot commit to routines that are unknown and not developed nor available. We just don't have them. We talked about it tonight. We have hopes and we have training. We just don't know what those are, and I can't commit to that without knowing what they are for 450 plus people. But HVAC systems are under central office's control. 5, stay home when not feeling well. Participate willingly in contact tracing efforts when there is a positive or suspected positive case. I cannot commit adherence to a policy that pertains to someone else's actions for which I do not control, but the HVAC systems are under central office's control. 6, assist with cleaning protocols by sanitizing high-touch areas like light switches and doorknobs throughout the day. Ensure spaces are clean between student use, such as shared materials, equipment, and small group tables, and keep windows and doors open to increase airflow. And again, I cannot commit adherence to unknown protocols in a policy that pertains to someone else's actions for which I do not control. But I'll repeat, the HVAC systems are under central office's control. These are a few of the concerns that FEA has. A lack of details to the specific protocols and the actual logistics of mask breaks, bathroom breaks, entering and leaving spaces, sanitization, and who is responsible for it, teaching remotely and in person simultaneously, and the list goes on. So back to that term rejected that I used, and when I just said this list goes on that I just referred to, FEA leadership has met since early July with Central Office administrative team in efforts to get issues resolved and to attempt to have an MOA all set for the start of the school year. We requested representation on the forums and committees. That request was not honored, which we believe put us in the place of trying to catch up to the information that is being put out there that are items to be bargained because they impact working conditions, wages, and/or hours. That unfortunate, regrettable decision has put us in the position where FEA and the school committee and Superintendent Duerr have been staggering through a clunky and at times disconnected process of announcing or voting upon decisions that are subject to bargaining. For example, FEA proposed a 47-point MOA, which included thoughtful, detailed items weeks ago. We received a response last Thursday with 21 items rejected, and just the word rejected, and sometimes there's a caveat to a counter, excuse me. And many of them refer to it is covered in the plan, which refers to the plan in the PowerPoint, Reimagining Learning. Since we were not represented as FEA members in creation of the plan, we will not sign the plan in its entirety into an MOA, whereby it becomes our contract. I want to acknowledge the bulk of people working on the plans were members, but they made it very clear that they were not there to bargain the contract, but rather they were there being the committed employees that they are. They volunteered for a task and they completed it with commitment and passion, but not as bargaining FEA leaders. We thank them and acknowledge all of that commitment. The purpose of this presentation, as it was framed by the invitation, was an update from FEA. So I just want to tell you about our bylaws and outline our purposes as an organization. 1, the Falmouth Educators Association will work for the welfare of the school children, the advancement of education, and the improvement of instructional opportunities for all. 2, to develop and promote the adoption of such ethical practices, policies, and the standards of preparation and participation as the mark of a professional. 3, to unify and strengthen the teaching profession, and to secure and maintain salaries, retirement, leave, and other working conditions necessary to support teaching as a profession. 4, to enable members to speak with a common voice on matters pertaining to the teaching profession and to represent their individual and common interests before the school committee and other legal authorities. FEA believes it is upholding its purpose as an organization, as well as our passion to work in the best interest of students at Falmouth Public Schools, only when it is safe for everyone. I know the school committee has received emails and that refer to FEA surveys. And so I have 3 before me that I have tried to cross-reference. I like to look at the data and see how the data changes over time, and so that is what I have done. Not all of the questions are exactly the same. I'll take that back. The surveys aren't exactly the same, but on the surveys there are some added questions, but there are ones that are consistent so that I can see the change over time. The first survey was July 27th. The second was August, I believe August 7th. And then the latest one, I'm sorry, August 12th. The latest one was the 20th. when I received this invitation, I wanted to make sure I had the most up-to-date data to share with you that I could. And so one that sticks out to me particularly, and if you don't know me as a teacher, data is my thing. I do like numbers. And so the initial survey was sent out about 3 weeks after the central office survey about people's preferences for how they would like to return to work. And so I asked a question, but they didn't have to prioritize their choices as a first choice, second choice, third choice.
Lori, I don't know if you have the data, but if you want to share, you should still have ability to share your screen if you wanted to just, instead of having to read it to us if you have it.
Thank you. I will share it. I can put it in a format to share. Because I would have had to flip. I didn't want to get people like the Blair Witch trial.
I just didn't want you to have to read to us if you're reading it from a tablet or from a table.
Yes, and it's not a lot, so I appreciate your attention. What is your preference for returning to teaching and learning next year? At that time, which I said was about 3 weeks after the central office survey, which in that survey, the caveats were the hybrid was, the in-person, anytime it was in person, was that you wouldn't have more than 10 people. Remember that initial guidance? No more than 10 people and 1 or possibly 2 adults in the room with desks 6 feet apart. So that was when this survey came out. And so this was within when it first changed. And so I wanted to see what was people's preference now that things have changed, because the plan started to become developed and we had some more details on what it might look like at different schools. And so there are 342 people that responded to this. And remember, we're about 450 members. So for 100% remote, I'll go for the lowest. The lowest was in person, which was 19%. The next was 100% remote, which was at 29%. And then 51% was for hybrid. And in that hybrid choice, it said potential to include a staggered and/or phased-in approach with some in-person and some remote to start and be adjusted. On the next survey that went out for the question that referred to that same item, and this talked about with what you know now, what the current environment is now. We had 50% said 100% remote. Hybrid was 31%. I paused there because for the hybrid again, I said looks different at Lawrence and FHS because that was before Morse Pond School moved to the hybrid, and 100% in person, which includes blended learning. That's when we learned about this blended learning concept. And that was at 18%. And so the change, interestingly, was the large amount of people who were interested in the hybrid. And once it became, people became aware of the detail, the blended learning, they, pardon me, I'm sorry. They now obviously I didn't collect email addresses, so I don't have specifically if it's the same exact person, but overall the tone changed and it significantly went more to the 100% remote. And then on the last survey, which was just Friday evening, my fun Friday nights, if anyone ever wants to join me to make a survey. The question, and this was 333 responses. I still have it collecting, but I can call this a good sample, and I'm pleased with it, is I added one that was unsure because some of the feedback I was getting in the comments, people kept saying, you made me, this is a required item, and I had to pick one, but I waver back and forth. Everything keeps changing so much that I waver, so I added unsure. So this is about returning to school. The largest percentage was unsure. My answer varies depending on many factors. And then we had 34% at 100% remote and 17% hybrid, and it doesn't show what the remaining percentage is if someone wants to do the math. That is the remainder of those people. Some things I wanted to point out were some of the comments. And so, oh, there it is, sorry. For that item about returning, I just want to give you a couple snippets of what people gave for feedback. There was a lot of them did have the same kind of salient theme. But the biggest concern, one of the bigger concerns with this item is being adults, we don't have the same data to show like students do. So all we've been talking about are the students. And so this one says, I do not feel safe returning to school, but I cannot afford to take a year off. I have a medical condition that puts me at high risk combined with my age. We have Zoom meetings and virtual doctor's appointments, but we can put 20 kids in a class 3 feet apart with 2 6-inch windows. I would have to sterilize desks and chairs daily because they don't do this. We have limited to no cleaning products. The air quality is poor. The roof leaks and the floors collect water when it's hot. We do not know how this virus affects the body and different organs and its long-term effects. Personally, I lose sleep over this because I know I will be putting my family and grandparents at risk. I have some other items that pertain, comments that pertain to it, but are on different surveys because, like I said, they end up with the same questions. But one that really stuck out to me was one that I couldn't really put and connect to an item. And I think it's pretty telling of where people are. Excuse me for the shuffle. What's the plan for high-risk teachers or those who live with high-risk teachers? How can in-person plans minimize cohort and teaching and teacher mixing as much as possible? What is the role of the parent staff reopening group? How is that group selected? What happens when someone gets sick? What happens when someone dies? Why is there no plan to test students or educators? How will we support educators who also have kids in school, possibly on a different schedule? What data and medical advice is being used to develop school plans? Is the district seeking advice from multiple doctors and public health specialists or one? What specific metrics will be used to decide when we are remote, when we're hybrid, and when we're in person? Why is 3 feet acceptable in a classroom when you still need 12 feet between groups at the beach and the reopening meetings are happening remotely? Why are we using distance between people to determine school occupancy instead of a measure of building space like every other industry? What is being done to upgrade HVAC systems? Can Lawrence windows be adjusted to open more than 4 inches? Is anyone purchasing fans or air filters for classrooms? How can we partner with local businesses to make things work for parents and schools? Can we work with the business community to encourage as much face mask wearing as possible in Falmouth prior to school reopening? Can we encourage local businesses to offer flexibility for parents who have students learning remotely at home? This goes on and on, but I think you get the general gist that this is not about saying that we don't want to go back. We have a plan to re-enter, but we don't have protocols, and there are still many unanswered questions that people have. Another item that I wanted to point out from the surveys, and I'm almost done, I promise, and I thank you for your gracious leniency on the time, is about the remote teaching. I'm sorry, the blended learning. And people are unsure of how that's going to look and how they would be able to do it. As I outlined, we all went to school and not to be this kind of teacher. And I think people are not confident that we can become one if you didn't take advantage of the opportunity or you were able to because you maybe don't work or you have a schedule in the summer that you can take the courses. But if not, you know, we're relying on 10 days of potential PD to be ready to be a new teacher. This comment is from someone who taught in the Lawrence Summer Learning Academy in the summer school. It's the hybrid model, requires a lot of pre-planning, but it is doable. The digital only is really hard. not being able to put the kids in pairs, no stations work, trying not to get too close to the kids when helping them navigate a web page. It's like being a first-year teacher all over again, not knowing what will work instructionally and what won't, trying to figure out classroom management when you can't use any of your usual tricks. And I only have 3 kids at a time. My health will be in jeopardy returning full-time, but I need to support my family. I will be meeting with a lawyer to create a will, which I had planned to do at some point. I need to make sure my family is taken care of. It is not me overreacting. It is my age and pre-existing condition that puts me in the high-risk zone. I do not go to the grocery store or stores. We have not gone to get haircuts, but hair places have more safety precautions than our schools. Wait outside, get a temp check, then you can go to pro cuts. But school, sure, just go into the school. The FEA is my only hope. I believe FEA is committed to the bargaining process, but we do not want bargaining that changes, but we do not want bargaining the changes in our work. We do want bargaining in the changes in our working conditions and commitment to healthy working conditions. And we don't want those to be an afterthought to submitting plans and voting on said plans. We do believe we will get there, but make no mistake, we want to be in school with our students, but only when it's safe for everyone. And we teach. Thank you.
Thanks, Lori. I'm sure that their committee members might have some questions. I know a lot of the initial things that you brought up were tied to HVAC, so we'll go to Patrick to try and address some of those, because I'm guessing a lot of the questions that the committee members will have are tied to that. Sorry to put you on the spot, Patrick, but
no,
you're used to it.
That's fine. Yeah, so what's interesting about this is at 9 a.m. on Friday, August 14th, the superintendent had a meeting with teachers, the school community employees, and the same question was asked. And at that time, I stated that the district had signed an agreement with TRC companies to do a review, inspection, analysis, recommendations of the school district's HVAC systems. And the process for choosing TRC was a useful process in terms of trying to understand what we're trying to do with this review and analysis. So the recommendations that they spoke of the DESE recommendations, was a list of architects, pre-approved architects that are allowed to, do building projects through MSBA. When I saw that list, I laughed because a couple of those architects had been sued by the town of Falmouth. And the other side of that is that what you're really trying to do here is you're doing two things. You want a HVAC or mechanical engineer to review how the systems are working. And many architectural firms have those types of engineers on staff. But we don't really, yeah, that's going to be nice to know. But what do we really want to ask? We're asking about sort of the environmental issues that relate to this. So I'm really looking for an environmental consultant. The company that has been working with the district for a number of years, and I should say is now called TRC. It was a smaller company that was purchased by TRC, and they have been our environmental consultants working with us primarily around HERO-related or asbestos-related projects and all the regulatory stuff and the testing that's required to that. So I reached out to them, and that company now, TRC Companies, has a building science and industrial hygiene group. They know how to do this stuff. They know what the mechanical engineer is supposed to look for, what the environmental engineer is supposed to look for, if and when testing is required, how the buildings work, both mechanically and environmentally. You know, they understand what it means when, you know, when you open the windows and if you get pollen in the air, that can affect air quality. They understand, you know, the whole range of issues. So we did engage them. They've been doing work for us over the years, you know, whenever we have asbestos related projects. So they know our buildings already, which is huge on this. You don't want to be having somebody who's sort of learning a building. So the fantastic thing is that because we have this relationship with them, now lots of districts are looking for this type of service, is they were able to start last week, which was unbelievable to me that they were able to start this work last week. So I gave that update to folks on Friday, August 14th. It was, you know, the superintendent's calling of hundreds, literally hundreds of our staff, and I was pleased to give that update. And they began the work last week. You know, I'm not going to, you know, oversell or overpromise when the report's going to come, but when the report comes, we'll share the report. And then the final thing I want to say is that, and just repeat because I've said this before, is relative to many schools, school districts, Falmouth is in pretty good shape relative to our HVAC systems. It doesn't mean it doesn't get hot. You know, there's a difference between hot in a hot building, because we don't have AC in our buildings, and what the air quality might be. You know, the East Falmouth univent system and boiler system is brand new, meaning it just got finished, and we're doing the punch list last week. The Teaticket system is like a year or 2 or 3 years old, so, and I'm confusing the timing on that. The Lawrence system, I think, is 2 years. The Teaticket system is 3 years old. Relative to many school districts, our systems are not particularly old. So we're our foundational setup is pretty good. Will there be findings? Sure, absolutely. I know there will be findings, and we'll make changes, we'll make recommendations, and we'll make fixes. Before this even started, we just from our own research and sort of the work that we've been doing related to you know, sharing best practices across districts, we moved from the filtering system in all the univents and in heating systems. Our MERV rated 8 or 9 is what the filters typically are called for. The recommendation was to move up to a hospital grade filter, a MERV 13 filter. We bought those a while ago, which we were fortunate to sort of be aggressive in purchasing those, and they're starting to come in and are being purchased. The other question that came up, and just in terms of learning how these systems work, the boiler does not have to be running for the fans to be running to be circulating air in the system. So the fans can begin to run, begin circulating air, and, you know, pushing air in and circulating air back out. So there's a distinct difference between a hot room and a room that has, you know, poor environmentals or something like that. And then the other thing is we jump into what the calendar is going to look like. You're going to see that some of the concerns about going to school during the summertime and being in hot buildings may just pass us by. So I hope some of those responses are helpful. I thought I had addressed most of the questions when on August 14th, we had questions from hundreds of school staff members. But the work has begun. When we have you know, the response from TRC, we'll share it, make it public. There's nothing to hide, and we'll keep going. And when we learn something, we'll do it.
Thank you. I didn't mean to jump right to you, Patrick, but I was guessing a lot of our committee questions
Oh,
would
that's
be
fine.
tied to
That's
the
fine.
HVAC, and so I'm just trying to
Yep.
prevent us going back and forth. Natalie.
Yep.
Great, thank you. So first, Lori, thank you so much for being here. This was really helpful for me. You mentioned a few times, only when it's safe. And then we also mentioned the HVAC system. Could you speak to the top bullet points or items from an FEA perspective that defines safety from your end?
The lack of 6-foot space, that if the desks or chairs, excuse me, are 6 feet apart, and we're getting messages that I think at the last health and safety forum, Dr. Parkinson said that, you know, it's not like you just have to stand, like it's okay, you can kind of move around the classroom. You can't get that much distance because you're going to have a kid on either side of you walking through the row. And that means that let's just take an average. I know it's not my body, but 1 foot of width, right? And that takes up, and plus the desks, because it's measured by the chairs. So you are not able, unless you stay in the front of that room, in that area that isn't completely the whole front of the room, but just where the board is, and it's measured to the 6 feet. We also have issues, I believe, I don't know if there's an agreement with the fire inspectors. They come around always right before kids come in. I'm usually in setting up my classroom when I was a teacher, when they come through and inspect the rooms and tell you need to move this from the water sprinkler and you need 3 feet on either side. And they come in and, you need to have a clear path from the door entering into your classroom to the door to exit the classroom so that it's a clear path. So I remember one year I had my desk, I thought it was in a great spot, and they came in and said, you can't do that because you need a clear space between the doors. There are also desks that are up so close to the front of the room that isn't in that zone where a teacher can stand, that the students can't even see the board. So then I think it would promote a teacher to try to want to help more, which then would put them closer and closer contact with students. So I think, those examples are ones that are coming to mind. I think when we talk about safe, we're also talking about the social emotional well-being of students. And some of the desks look like they're in the corner, which we know we haven't done to students in forever. And so they're in corners of rooms and up against the wall, which very much looks like a timeout kind of situation. And so we don't feel that is safe as well. So I think some of them are physical safety, and some are, emotional, social emotional well-being. We're very concerned about a student that is the one. He's the kid that comes in and gets people sick, or she's the one. And everyone from the class, the cohort has to go home. And then, God forbid somebody dies, and the guilt that will be in this student's life and or their family. They go home and they get someone sick in their family. Our school adjustment counselors are highly concerned about that. And the impact that has. And, we have students that in this community have dealt with death of parents and family members. And we know the toll that has taken on them. And our school adjustment counselors are very concerned about that. So those are just to name a few off the top of my head, Natalie.
Okay, thank you. And then
You're welcome.
question to Lori and Patrick regarding Lori Andre's statement about the fire inspectors in the classroom. Can you speak to that a little bit?
Yeah, from the very beginning, we've been in touch with the Falmouth Fire Department about this. That was one of our earliest conversations to confirm that how we were setting up the rooms would meet fire codes, because fire codes have not changed, right? There's still a responsibility to meet fire codes. There's still a responsibility, we're gonna have some level of fire drills, when children get back to school. They're gonna be different, but we're gonna do that. So fire codes haven't changed, and from the very beginning, when we knew we had to set up rooms differently, we were in conversation with the Falmouth Fire Department. And we communicated that through the district's safety committee, which we've had a meeting. There was, I believe, 24 people, many members of the FEA, many members of the, the first responders in town, that we have that meeting regularly, and that communication happened there. So, this isn't a surprise to anybody. This has been part of the conversations from the very beginning.
Leah.
Can I respond to that? May I? Or just questions? Okay.
Yeah, I mean, I don't want to get into a situation where we're, going back and forth debating. I just want to make sure we get some information out there.
No, I just was at the meeting Patrick's talking about, and I don't remember coming away with that. I remember saying we would reconvene in order to figure it out. And I don't remember ever hearing about fire code. So, unless it's another meeting.
Leah, you're up.
So I want to thank you, Lori, and Dr. Parkinson. It was really nice to hear both your presentations and kind of get the context of really understanding a little bit more about what's going on. So I think actually my first question is kind of to Patrick also. So we're talking about, and Lori, I heard it very clear, this concern about the HVAC system. And I guess my question is, how do we know what a safe system is? And how can we make sure that staff know this and that families know this? So this question is, you have to rely on what is the evidence out there about how the virus transmits, right? So has it been transmitted in locations through buildings in the U.S. that have, high density of these people with the virus since we've started wearing masks and washing our hands and doing those kind of things? That's not what's transmitting. The buildings aren't transmitting this virus. We're learning about this over time. One of the things that we all were concerned about way back in the beginning was, touching our groceries and touching things. That's changed over time. So now we're saying, okay, it's okay to wash your hands, but that's not how this transmits. So you just, going back to what Dr. Parkinson said and Scott McGann said is, if you keep focusing on the things like wearing a mask, good hygiene, keep a few feet from each other, you're going to be okay. And stay home if you're sick, you're going to be okay. This work around building sanitation, building hygiene is all good and the right thing to do. The MERV 13 filters, I wish somebody would have made that recommendation to schools 20 years ago, because that reduces the flu. And that's going to increase the overall health of this. So those are the kind of things you rely on. Is one thing going to be the difference between, making sure that no one gets this? No, it's going to be a lot of little things, which Dr. Parkinson says. This is one of the things that we're going to continue to work on, and making sure that our buildings have very high level of hygiene. But the most important things that the community can do, both in school and out of school, are wear a mask, wash your hands, keep a few feet of distance. And if we do that in and out of schools, we're going to continue to see the numbers that we've been achieving in this community. So
Leah, sorry, I was going to follow up with your comment too, that I think that's why we hire, my understanding is that's why we're hiring this, I already forgot who you said it was, to come in, and I'm hoping that report will not just tell us what's wrong with our buildings, but also will tell us the things that we can do to be more safe. Leah, is that what you're getting at?
Yes. I mean, I'm hearing the concern of the union around our buildings, and it's about, I believe it's about airflow, really. We're talking about aerosols. We know now, that is a big concern with spread. So yes, I mean, I'm thinking that we have the hospitals, right, which are probably a really good resource and that's where we get the 13 MERV. Am I saying that right? The filter. So yes, I mean, that's it. I want an expert, right? It sounds like, Patrick, you've done your due diligence to find the expert who can look at these things and ensure that our HVAC systems are safe for adults and children that we're bringing into our schools. Yeah, go ahead.
I didn't know the group that there was such a profession, but building science and industrial hygiene group feels like the right people to bring in.
Yes.
Just by the title, right? And when you looked at the proposal and all their expertise, it obviously was, and the experience they've provided to us over the years in Falmouth, we trust them already. So we're very pleased with being able to bring them into Falmouth.
So I just want to add to this, because that's one concern, for safety pieces. So Lori, in hearing what the safety concerns are, and then the other piece around the 6-foot distance. And I know, Lori, you mentioned around thinking about these protocols, and that it made you uncomfortable being responsible for others with these procedures and protocols. But I want to go back to what Dr. Parkinson said, and what really rang true with me is that this is a community effort, that we need everyone to be on board with these protocols and these procedures to keep everyone safe. And this is every adult, every child in the schools. So I guess my question to you, Lori, is, do you feel that you're not familiar with the protocols? What is it that made you feel that way, of saying you didn't feel that you could be responsible for other people with these protocols or procedures?
Lori.
The fact that we don't have them clearly outlined, we don't know how it's going to work. And we keep hearing the word hope, and we have a lot of hope too, but we don't want to put the safety before the hope that it works. So I don't know what they are. I don't know how we're going to get kids one at a time into a bathroom and out again, and still supervise and still work with kids that are there and the kids that aren't there, and how much time the kids that aren't there are going to be waiting for us to complete the protocols, and how much actual teaching time. And that's the issue I have with the protocols, is we don't have them detailed. We can say to wash your hands and use hand sanitizer, but we don't know how we're going to get through the process to do that.
All right. And following up with Dr. Duerr, Lori, about this, would that would be part of the professional development, right? Of ensuring that every staff member feels comfortable with these protocols and is fully aware, right?
Yes, that's correct. We have created, our nurses have created actually wonderful, I'm getting through them all now, modules for the training for the teachers. They're very thorough, very proud of what they put together, along with Joan Woodward and Dr. Parkinson have been working on them, but they're really very good and very detailed. And that is the very first thing that's going to happen before all the staff come back to the buildings, right? We're going to go through those. But but I do want to go back to the same thing that the CDC, the World Health Organization, our Massachusetts Health Department. It is a combination of strategies, and the strategies being that of wearing the mask, distancing, and washing the hands, right? And it's the combination of strategies. It's not one single strategy that is going to keep us safe, and needing to know that. Now, I certainly hear, Lori's concerned about, well, how does that actually play out? What's the implementation of these rules, right? So we have the protocols in place, and to your point, Leah, that is what the training in the beginning of the school. We will be in school for 10 days before, well, 12 days before actually students arrive. Lots of time to be able to practice, to review, make sure everyone understands. We even have we'll be recommending here later that the first week would be remote, right? So we'll have the first start date. even during that time, to be able to take time to teach our students what the protocols are, what it's going to look like. So when they walk into the building, they've already heard all this, they've seen pictures of the classrooms and what's different, and then be able to, from the beginning, be able to help them as they walk into the buildings with those protocols. So yes, we absolutely believe in the professional development and the teaching that's going to have to take place for both our teachers and our students.
Any other questions while we have Lori with us? Andrea.
Yeah, I guess I had two questions. One, Lori, thank you for your presentation. I was wondering if you could clarify something for me. There was, and maybe I just misheard, there was a part where you were saying that FEA members were not part of forums and committees, but then another point I thought you said that they actually were part of it and helped to make the plans. So could you let me know which one of those was actually correct?
Actually, they both are, because what I meant by that, and I'm glad you asked me to clarify, is that teachers, educators, some were nurses, some, myself, I'm on one, were in the re-entry planning teams. People were asked to volunteer. We were there, and we are FEA members, but we were there as teachers and assistant principals, and we were asked to do a job which people were committed to doing. When we were interested and asked to have an FEA representative on the forums and to have it as FEA representation, the difference is that when you're there as a teacher, you're there and you're doing the job that's been tasked of you. When you are there as an FEA representative, you are a guardian of the contract. So for instance, in some of the plans, like at Lawrence School, early on, and still now, the students won't be moving, but the teachers will. And the teachers will have carts. And at one point, they didn't have lunch. And so even though there were members there, I'm sorry, a duty-free lunch, meaning that they would eat with the kids. And in our contract, it's guaranteed that we would have a duty-free lunch. People did not necessarily stand up to say, hey, you know what, we're supposed to have this duty-free lunch. They didn't do it in the forum because they waited to address it as an FEA representative or a building director if they were there or if somebody told them. So they were not there to defend the contract and to make sure that the plans that were being constructed were in line with the contract. They were not there to say, hey, isn't this an item that is supposed to be bargained to change in working condition? Because that can be counterproductive to moving forward. They knew what their role was. They were asked to volunteer as teachers. They were not asked to volunteer as FEA leadership or anyone that represented anyone on the bargaining team. Is that more clear?
Yes.
So I guess it would be like you're a school committee member, right? When you're here, you are a representative. But when you leave here and maybe you're in the role of your parent, you're not necessarily acting as the school committee, but you are both people. But you know which forum and what role and what hat, I guess, if you will, to put on. I do it all the time. I have a lot of roles, and they're big roles. And some people can do it better than others. People aren't comfortable when you have your principal and, assistant principal even, or whomever, and they're rolling out and talking about this plan and this idea. Not everybody is comfortable saying, hey, wait a minute. And that's why we asked for actual FEA representation, not just FEA members.
Okay, that makes sense. Yeah, thank you for that.
You're welcome.
I guess the other thing that I guess I'm trying to understand, and this is for, I guess, maybe Dr. Duerr. So Dr. Parkinson, one of his points that resonated with me, and I think with others, because it's already been mentioned, is that fear of the unknown, right? And you know, we also heard here tonight that like we're sort of asking teachers to come in on some levels and do a new job, and we know how it feels to be on the first day of a new job. So, but there's all this plan in place to, and time allotted to help get people comfortable with that, to really get into the nitty gritty of these protocols and procedures and to learn them and practice them until comfort is felt. So my guess, my gut tells me that a lot of that will be dealt with during that time period. And I think a lot of people will feel more comfort, but it probably won't be 100%. So what would potentially happen then? Is there a fallback? Is there something that we could do when we've tried everything and we still have teachers that say, this just isn't working for me?
Yeah, thank you, Andrea. We do have a process in place, and it's actually been in place for several weeks now, and we've been going through the protocols with that. So, and that's handled, it's a personnel matter, it's confidential, and it's handled through the HR department.
Okay, great. Thank you.
John.
Yeah, Laurie, again, thank you as well, and thanks to Dr. Parkinson as well earlier. But I appreciated being part of the Health and Safety Forum and hearing firsthand the teachers, the support staff, and everybody that was involved, voicing you know, what their thoughts were and their feelings. You know, clearly what you all do is really, you know, what makes the school system work. Without teachers and support staff and custodians and bus drivers and everybody, we don't have a school system. So thank you. One of the things you said jumped out at me. Well, first off, I do think at some point we're going to get together and be able to move forward. And I think part of that is just, you know, fine tuning everything and getting, you know, just to move forward and to do it. With that said, I see some of the things you raised with HVAC and everything, and I see Patrick could address that, and we'll get more answers on that as well. One of the things when you brought up the student with, if, you know, God forbid something happens and they had a traumatic thing where they tested positive. A thing that I noticed in the list of items that you were looking to have done is one of them that said any student or employee suspected of having contracted COVID-19 shall be held in a designated isolation area and sent home. What jumped out at me with that was kind of what you were saying of the kids taking it to heart and feeling, you know, as if, you know, some kind of stigma. I think any type of area in that nature, I definitely feel should be done in a manner that is done very with the thoughts and the care of the student's emotional well-being. And then the scenario that you painted, which is plausible. I mean, it's one of the things that exists in this brave new world that we exist. About the potential for that individual, if it went down the steps that you described, of the social and emotional impact on that child. What I will put forth is, I think the benefit of getting the students in the schools, the social and emotional impact that is much more likely to happen, of the positivity of the kids interacting with each other and the teachers, we, you know, are potentially avoid a generation of kids that go a couple of years without interacting with people. And I do think the multiplier effect of that is far more, you know, more possible to be a negative social emotionally. Thank you.
Thanks, John. Any other questions? Lisa.
Thank you. This obviously is for Lori, and thank you for your presentation. It definitely helped clarify some things. But I thought your surveys were really interesting. And your last survey, if I'm quoting this correctly, please let me know if I'm not. You had 333 responses, and 17% were in favor for the hybrid, and 34% were in favor for 100% remote. then the rest were just unsure. Am I correct on that?
No, I didn't do the math, Lisa. So it was 40% were unsure. So you just have to add that up and whatever the remainder is from 100. It doesn't
Okay.
have it on here because it was so much smaller than the rest of the pie, I guess the easy way to say it.
But even still, though,
And that was 100% in person, that the last piece of data, because there were 4 choices.
okay. So it sounds though that the teachers definitely want to come back to school, right?
Oh, I thought I said it over and over again. We do want to come in.
Right, exactly. And then throughout your presentation, you had mentioned that you could not commit on behalf of those that you can't control, but then you referred to the HVAC needing to be, make sure that the HVAC was okay. So my question is, if all the tests come back with the HVAC system, do you feel that the teachers would then feel more confident, or is there still another layer of concern? And does that relate back to perhaps the numbers of cases in town? Or I'm trying to figure out what safe looks like for teachers to feel comfortable enough to come back. Does that make sense?
Yes, because I think we're grappling with the same thing. And that's what I meant about not having clear understanding of what the protocols are. I hear that we're going to learn them through modules on the first day, that teachers, classroom teachers and teacher assistants and nurses are due back. But, I just off the top of my head have some concerns about having 10 days time after that if we're going to focus on instruction. I mean, we haven't talked about instruction, barely anything of what we're talking about right now. And that's why I kept saying, and we teach. So everything that we've been talking about are all of the things that are concerning us, and then we teach. So it's a lot, and that concerns people as well. But I think that there has been growing evidence that the virus can remain airborne for longer times and further distances than thought. The issue is the layout of the classroom, and it's a confined space. Opening doors and windows, as you've heard, not all windows open completely. I mean, you may envision in your mind. Most of them flip out. So actually the air would have to go down and up in if it were actually moving. It really depends on if you get moving air from outside, and I'm not particularly sure if that's even safer where the aerosol and it stays and it goes further. So I think it's the number of people in the room, in the layout of the room, and that Patrick already admitted that, not even admitted, but he stated that, is he sure? Can he say that 100% is going to come through and be fine? And you're going to get the report? I've seen some of them that have been shared with me, and they are extensive. It talks about how much air has to move per minute and circulate per minute to improve air quality. So there are a lot of factors that are involved in the air quality. We, the fact of moving air and air quality and air flow, although I showed you the thermostats and how hot it can get in the rooms, that was an indication of what air doesn't move, because it doesn't have to be a stifling hot day to be hot in the building. And so that was what that was more about, versus talking about air conditioning and having it be cool, is that there isn't airflow. And when teachers are in there, right now, with our ALICE training, we haven't been allowed to open any doors when students are in the room. You can't prop them open. You can't leave them propped open when you're not in the room. So that has been changed so that we can do that. That's a safety issue teachers still have. They're still concerned with all the training we've had on intruders and in doing our drills and things. So even with the doors open, because no kids are in there, and teachers are in setting up their rooms if they have the chance to do it, and some did it voluntarily to make the videos, that even when you're in there and there's nobody else in there, it's still hot and it's muggy and it's sticky, which we feel speaks to the lack of ventilation and airflow. And many, it's been reported from other buildings, but I know in the one I work in that on days that it's bad, the floor actually has condensation on it and people have slipped and fallen. And typically the custodians doing their due diligence go around and try to dry up the floors with towels. So that was another issue that was brought up that people felt spoke to the lack of ventilation and airflow. I don't know if I answered your question, Lisa.
I mean, well, I mean, you did tenfold, and I think it sounds like it's just way more than just that HVAC. And I'm just wondering how we'll ever get beyond all of these issues, because your room size is only going to be so big. You're only going to have so many space between desks. The temperature is because it's hot outside. Like, there's so many factors that I'm not sure how we would be able to change. And,
we agree.
You know, and so is that what you're asking, is then that perhaps that you want to be 100% remote? And if you want to be 100% remote, do we wait until there's no cases in the state of Massachusetts, or when is it safe enough that we can open the doors again? Because I feel like there's just, I'm not sure how to appease you, I guess, or appease the union.
Oh, I don't think we have to be appeased. We just need to, we're asking for it to be safe for everyone. And if that's not the case, it's not done to purposefully stalwart or to purposefully stop the work that's been put into plans. We are just simply asking for it to be safe for everyone. And I don't think that's an appeasement. I think we're talking about people's health and safety, and it's not just the students that are there. And so I just don't know.
So
I'm not looking to be appeased. We're just looking for it to be safe for everyone. If there's ample money and the systems aren't working properly, you know, then there are other ways to get air to move. And there have to be ways that can be done safely so that it is safe for everyone.
Oh, that was really loud. Sorry. I don't know what that was, but it was very loud. Melissa.
It sounded like my cue. Hold on, I'll mute.
Thank you, Lori Andrade, for being here. Thank you, Dr. Parkinson and Scott again. So again, I'm going to come back to the HVAC system that Mr. Murphy is having evaluated. As we know, it falls under central office. Dr. Parkinson, who's a respected physician, not only by our district, but by our community, mentioned that the flu is more deadly than COVID-19. And I never once heard questions about the HVAC before this year. I still, if we have a straight answer from the engineering firm, and I'm sorry, I can't remember the name, that
TRC.
TRC, excuse me. When we have a straight answer from TRC of the air quality and the filters, the hospital grade filters, is that enough? If we have community involvement and our community is now in the white, which is less than 0.5% positive, is that enough? If our students are wearing masks, they're keeping their social distancing with 6 feet when reasonable, is that enough? At what point is it enough? I've asked multiple teachers, confidently, of course. I would never breach anyone's confidentiality. Exactly what do you call safe? I hear what you're saying, Lori. I appreciate your surveys. But I'm still, what does it take? When do teachers, at what point is it that teachers are going to feel confident to walk in the building with the students who are waiting for their education.
From the survey results and the comments, I would say one big factor is getting the report and seeing what, like Patrick said, he knows there'll be some issues, that not all the buildings are brand new, to see that. The reports that I have seen, if it's to the caliber of the ones I've seen that are from DESE approved vendors, are very, very detailed. I think we would probably all need some help having it be interpreted to know what the results of it, the impact of the results of the test, of the assessment, excuse me. So that would be one. I think having the thought that we're working with the local fire department and the distance that we've learned about in the past of having doors that open freely and don't bump into a desk or someone sitting, those would be some definite safety concerns. The distance of not being able to have, as an adult, the distance that you need to be away from kids to be safe. We have, we feel the same way with students. I mean, it's not to say students could be the only ones that come into school unwittingly asymptomatic. It could be adults as well. We also feel that sorry, I lost my train of thought. So that it's also about the kids. It's not just about us, but if, the HVAC system's about everybody in the room.
So again, I just want to come back to the flu is far more deadly than COVID-19. We haven't heard previously. I feel like we're I don't want to say stuck on the HVAC system being our savior to all of this. Like you, Lori, you wear many hats that are very big hats, bigger hats, very large hats. I too wear a couple of large hats. One is I'm a parent and I'm also a school committee member. And I'm frustrated because it was our job as a society, as a country, as whatever, to help flatten the curve. We've done it. We're continuing to follow the model. We're doing everything as a society that Dr. Parkinson laid out. If the community does a correct thing, the schools will follow. I hear you on the we don't have a protocol. I'm putting lots of confidence in the 10 PD days that there will be protocols in place. I know that has been touched upon this evening. And I just also want to echo Dr. Parkinson's statement that people aren't perfect, and going into school is not walking into a COVID ICU where, there's lots of protocols in place and it's very scary. This is scary, and I certainly don't want to try to parallel that or minimize anyone's feelings for going back to work, and that's certainly not my intent. But we have to trust the process and the protocols that the health professionals are going to put in front of our staff. No one's a better teacher than a teacher, and nurses teach teachers. Another hat that I wear, and I trust them, and I trust our healthcare professionals in the 10 PB days that are going to teach our teachers. So help us parents, Lori, Andrea, who wears many beautiful, lovely, big hats, responsible hats. Help us parents who also wear hats understand that we are working together to get our students, our children, back to their education? What will it take? When is enough? Is it the HVAC? Is it the protocol?
We just don't have the info, Melissa. I can't answer you of when is enough. Like you said, there's so many unknowns.
But at some
And this
point,
isn't,
we've all been in the community. We've all been doing it. We've all been, somehow we've been out there. We've gone to the grocery store. Now I understand that there are staff members that have completely quarantined, and that goes for families as well. But since March, we all were in shock, and then somehow we've all found our own process to get through. How can we do that now? What would make the staff feel confident?
a lot of the items are items that were rejected in our bargaining, Melissa, and I don't want to compromise our bargaining. I was very careful not to do that.
Okay.
We had, like I said, we had 47 items, of which 28 were just rejected. So many of them, the 47 items that were there, the majority of them dealt with the issues I'm talking about right now. And so when you say we can work together, I agree with you.
So 2 follow-up questions with your 47 items. Have all of your 450 FEA members seen those 47 items?
No. It's based on feedback from the surveys. Some of them, so no one's gotten, like received our proposal, if that's what you mean. The only people that received our proposal were the people on your team.
Okay.
And our leadership team. We have an action network, which are actually our negotiations team that we typically formally negotiate the contract. So they're our group we bring it back to, not unlike when we meet with the superintendent and Patrick and Sonia and Joannie and Joan and Kelly, that they, you know what I mean, bring things back and report to their group. It's the same kind of structure. We do that with our negotiations team that are all elected by the FEA members, but we do not put it out to the membership until we have a tentative agreement on the whole thing, and then they will see it and they will be able to vote on it. So it's not just us negotiating with your team. In the past with the MOAs we've done last year, I think we went through maybe 3 iterations of it. Those were settled between myself, the team, without our negotiations chair, Rachel Zano. With this, because it's so huge and it's not something that I know we're not going to please everybody. And so I want to make sure everybody has their voice heard and they're able to vote on it. So that's going to be the difference with this MOA than ones in the past. And so maybe they haven't risen to the attention. We still have had difficult conversations when we've negotiated other MOAs. We have worked through them and have been able to come to something that we agree with, that we bring back to our constituents, but this one is one that the entire membership will vote on. And so that's something that I want to make sure that I am representing everyone to the best of my ability, because I cannot please everybody and I wouldn't feign to. And that's why I didn't want to just sign an MOA between myself and Dr. Duerr with the chairperson, Kelly Welch, because it affects everybody too gravely.
So so that being said, it affects everybody, but not everybody has seen the 47 item.
That is correct. That is customary, because it would be like compromising our bargaining, because people would think they didn't get things. And if they kept seeing the back and forth, I think in this one particularly might be a little discouraging, because we are having trouble trying to catch up to what's already getting put out and voted upon. And so I think it would be detrimental to the membership, actually, if we did that right now, but that's what the surveys are for. I didn't read off all the items that are on here, but the comments as well. We work through the comments to see what people want. Sometimes it's shaped to the next questions because we see something that comes up that we see people with differing opinions. We make it a question.
Okay.
Terri.
I'm wondering if perhaps we did another, this is for Lori and Lori, both Loris. If we did another survey after the teachers have been in the buildings, for one thing, we're trying to communicate over a summertime with surveys and all these things that are, people may be gone or the big thing that resonates from Dr. Parkinson's statement is the unknown. And once you start the practicing and once you get in those rooms and you have the governor in his wisdom, right? Not the governor, but whoever was responsible for the DESC and the governor, the whole state, they knew they needed extra time this year. So this extra time is to help people get acclimated. So you can probably better get a feeling of how the whole union feels because you're in the building, you're actually, and I hope they do have kids have to go to practice, having kids have to go to the bathroom in the middle of the day or, get out those doors and everything. Maybe after they're in there, it would behoove us to get a more concrete on-the-job survey. So I don't know what you two think of that. That's what I'm putting out there.
Lori, do you want to respond first?
No, thank you, Terri. I think it's an excellent idea for us to continue to survey and see where the staff are and how they feel.
And not just that, but then we can, there will be more PD coming, and then we'll know what it should be on, which would be really helpful instead of guessing before we do it what it should be about.
Right, but some of the only thing I would say is that not potentially, I know of 3 teachers, 2 of which have just been in the past 2 weeks that have put in for retirement that are some of our top stellar educators. And it is a great loss, and they're gone because they're not comfortable coming back in this environment. We do have people that are in high risk groups that we have as members. So when you say perhaps when everyone gets in, there is the potential that not everyone will get in. And they want to be educators and teaching and viable. And there are many things that can be done remotely. Look, we're teaching half of, hybrid model, you're teaching half of your kids remotely. So if we can do remote work effectively, then we believe there could be teachers that can just teach remotely more than at pre-K, K, and 1. And so we do have a lot of concerns, and we do have discussions pending right now about our approach to supporting members in high-risk groups and what we can do for them to have them be able to continue to do their job in this environment and potentially remote, which doesn't mean remote in a remote place in the building, because their doctor's notes say it's not safe for them to go into the building. So I don't want to get too deep into that. I'm just saying to you, when you say everyone and all teachers, that could potentially really not happen, because there is the real potential that teachers will either take leave, which would be unpaid, and most can't afford it. And there are ones that are retiring reluctantly, but feel they have no choice. And we're losing some great teachers, and there is a potential that there could be more, because we're still trying to figure out what it's going to be for teachers to be working when students aren't there. And so there are discussions that we're having. So I just want you to not think just blanket across the board that just teachers and we're all going to go in and we're all going to feel good and be able to go in when it's just teachers, because there are people who are not in that position to have that be something that they can do. I just want to be realistic.
Any last questions?
I'm sorry, I did want to respond because my intent, I do surveys. That's what I said in my joke about Friday nights. I've also invited people to do watch parties with me with the school committee because as you all look at, we're all here and putting a lot of time in, and it is important. But I do intend to continue to put out surveys. I've been doing them almost weekly at this point, and I will continue to do so. So I typically share them verbally with in bargaining so that, you could always talk to Kelly if she's at the meetings, which she typically has. She's been at every one, that she can share that data with you.
Thank you.
You're welcome.
So my question is actually exactly tied to that. So you were reading some of the comment sections from the surveys, and a lot of them had, a litany of questions, as is totally reasonable. But I feel like, I couldn't possibly jot them all down. There were too many, but I feel like there are a number of them that even I know the answer to. And so that makes me think that we could probably take another stab at like the FAQ type model or something where we can try to get the answers to some of those questions that we do have answers to out to people, because we don't want to have, we don't want to have questions hanging out there. If there's so many things we don't know, if we can answer some of them, I think that'd be really helpful. So if you're comfortable sharing the actual questions.
Yeah, I'll get with my leadership team. Our Vice President, Jim DC, has quite a knack for that, along with our PR and our Professional Rights and Responsibilities Chair, Sue Ripley-Young, and I'm sure they would be willing to put that together for our next meeting.
And I don't think it needs to be anything special. You've already collected it, just cut and paste.
That's what I'm saying. But, it's sometimes you can pull salient themes and but I do, to be fair, I read from 3 different surveys. And so when you say now you know the answers, the person who put that in could potentially already know the answers as well, because it could have been a survey, between these 3, which were the big ones that I had, versus just kind of 1 or 2 questions. So I just want to be fair that, there could be ones that have totally been answered, because, in the health and safety forums, in the staff forum, Dr. Duerr has been fielding as many questions as she can, as well as Scott McGann and Dr. Parkinson. And, I was talking about it with the superintendent the other day, that oftentimes, and I know because I'm having big FEA meetings that, have over 200 up to 300 people. And there's, you just get to a point where you'd be there all night. So, this is not for lack of trying, and it's not for lack of the willingness to be connected and to collaborate and to move forward. This was a request that I'm glad that you honored, in the fact that instead of, not just getting, because members should have an individual voice, and I'm glad they reached out to you individually. But I also feel, confident in the feedback that I get, that I am representing people in the way that they want to be represented. Will it be everyone? Will I please everyone? No, but I know you guys are in the same boat, all of us in the positions that we are in. But I want to end on the note that or at least end my portion, because I know there's more and it's late and I can appreciate that. But again, to reiterate that this is not anything to make any of us divisive. It's meant to open up and be transparent about what the issues were and what people wanted to know, what kind of was going on in the process, And so I think that, like I said, we've had difficult conversations before, and one of our norms is that when, we'll go into a situation knowing that we will come to a resolution. And so I intend, and so does my team, fully intend to continue to work in that manner, as well as to presume positive intentions.
Thanks, Lori.
You're welcome. Thank you, everybody.
Thanks for taking time with us tonight, and have a good evening, what's left of it.
I'll be right here with you.
Oh,
I might not be on the screen though. You can bump me off. Take me out of here. Ryan. So thank you all though.
Thank you. So, it's a theme. So we'll keep going and move right to Dr. Duerr and her update on everything COVID. Oh, you've moved on my screen, Lori. There you go.
Okay. I just want to go back to a couple points that I want to talk about. And I do think that maybe, people don't get all the information in, maybe a timely manner. Terry mentioned it's summertime. People may not get the information. So but I do want to clarify a few things that I think are really important for you as a school committee and for our community to know. It was brought up about the bathrooms, and I just want you to know that our principals are working very hard. There's no child that's not going to be able to go to the bathroom when they need to go to the bathroom for any reason. So yes, we are having scheduled bathroom breaks when all students can go, but that does not mean that students would not be allowed to go in between. So I just wanted to clarify that. And there may be information, when people maybe hear about that we're scheduling blocks where, classrooms can go to the bathroom, maybe that's a takeaway. Maybe we haven't been clear enough that doesn't mean that the children are not going to be able to go to the bathroom at other times. And the principals, again, have worked tremendous on every details of all these protocols. Sometimes if you're not on one of the planning teams, a school-based team, or one of the other larger teams, you may not hear all the information. I hear that from our parent and staff advisory, right? They always say, this is great conversation. We're understanding everything that's happening. Try to convey it in your letters. They're always encouraging to get things in the letters and, so that everybody can know. And then sometimes it's still not the same as being a part of a conversation. So we all know that. And so, but I just want to assure everybody that your child will go to the bathroom when they need to go to the bathroom. We are working out protocols for being able to do that. Wanted to just reiterate the importance of the combination of strategies. And when I put forth a joint letter that FEA and I could sign, I just wanted you to know that it was about the HVAC on that letter as well as everything that Lori had shared with you, because everything that you read and everything that's, it's not just one single thing. And so yes, is air quality important? Air flow is important, but the most important things, as Dr. Parkinson has mentioned, and certainly our guidance from the state, is we have to wear the mask, we've got to distance, we've got to wash our hands, and we have to stay home when we're sick. And when we do those things, that's making the biggest impact. It's already made the biggest impact. I think, as Dr. Parkinson and Melissa, some of the others you've pointed out, we've been doing a good job as a community. So I just want to state that it's hard to single out one thing and say that this will make the difference. It really is that combination of strategies. The nursing modules, I had that on my list. I just want to reiterate again, I am so proud of our nurses and the work that they have done over the summer. That was on my list to actually share. I think I've already shared that, and I know it's late, so I'm not going to spend more time. And maybe another time, Joan, that you could, maybe share some of the module with that. We'll make it available for the school committee members as well, so that they can see it, because very proud of you and your team and what you've put together. Joan, you were, so we'll hold that aside, but would you also address the other thing I had on my list? I get a lot of questions, and sometimes I want to use this forum so that the larger community can hear the answers, but about the PPE and what's going to be available for our staff. I know it's in our plan, but sometimes things get buried. So maybe you can talk a little bit about that. Thank you.
Certainly, I can pull up my PPE spreadsheet and give you a little bit of information there regarding that. So as we've mentioned in the past, and the district is absolutely committed to the provision of the personal protective equipment for both students and staff to make sure that we do have a safe and healthy school environment upon our return. As you know, I think we've reported this out in some other of the school committee meetings, but Patrick and I and the staff that we work with have been working diligently. Those include the school nurses, with the school nurses, the custodians, the administrative team, and this has all been in consultation with both Scott McGann and Dr. Parkinson, who are joining us tonight, in order to secure appropriate PPE that's in accordance with both the CDC and the Department of Elementary and Secondary Education guidelines and regulations. So, just for an example, we have in our possession over 50,000 adult medical masks, 14,000 children medical masks that go up to the age of 11. We have 4,000 cloth masks with the Falmouth logo on those that we will be distributing it out to every staff member and every student. We also have close to 2,000 KN95 masks. We have over 850 clear face masks for individuals that we spoke about before with hearing impairments, students in our specialized programs, students and staff in our specialized programs, to ensure we're meeting needs, speech and language, our early literacy needs. And we also have both adult size and children's size face shields. Additionally, and I know we spoke a little bit about the medical waiting room. So we have isolation gowns, gloves, shoe covers, eye protection. We have the no-touch thermometers, the hand sanitizers, the sanitizing wipes, specialized equipment for the medical rooms as well, including the pulse ox, the stethoscopes, waste disposal bins. Some of the other things that we're also working on is we've ordered the protective desk shields to make sure that we have the provision of different types of specialized instruction, as well as face-to-face assessments and evaluations, that we have those available for our staff. And I think embedded throughout this entire conversation, it's been very clear for all stakeholders here tonight that we have been discussing how we continue to monitor the guidance that is being provided to us, as well as the local health metrics here in Falmouth. And we're committed to making any adjustments that we need. So hopefully this clarifies a little bit, but I'm certainly happy to share anything else.
Thank you. I love hearing the list. It makes me feel better.
Yes. And then I just wanted to, there was some updates to the plan. I just want everybody to know, the committee, which I know I let you know, but the community, that the plan gets updated as soon as we get new guidance. What's on the website is, the latest version. And there was one other thing I just wanted to mention. Early on, it was the guidance that it was grades 2 through 12 that would be required to wear a mask and encouraged at the other younger grades. But we since have changed that, and we have sent it out in case anybody has missed that. All students in the Falmouth Public Schools will be required to wear a mask. And that was just with more recent guidance, more discussions, always including, Dr. Parkinson in the conversations and what that looks like, and talking through it. So that was one update, and everyone will be wearing a mask. Okay, so okay, sure, Leah.
Question about that does that include pre-K students?
So pre-K, it doesn't. So Kate, thank you for clarifying. K through, that doesn't mean that pre-K, some of the students may not wear, because there are parents that actually do require their children to wear a mask at pre-K. So Dr. Parkinson was basically, he's not here, I'd let him speak, but basically said with the pre-K, if they can, great. If they can't, that age, we can't worry about it. But K, we can start, I think that we can start, teaching and having them wear the mask, and we'll, and if not, maybe a shield, right? Because a shield can't replace the mask, but a shield's better than nothing, right? So the shields could be considered at some of the younger ages. I wanted to share some survey data since you were asking about surveys. If you can hang in with me for just a few minutes, because I would like to share that. I just got to figure out, where is it? All right, here we go. So I'll do. All right, so our very first survey that we put out, and this was back in June, I had brought it up a few times during our meetings, and someone had asked me what exactly. So this survey was early on, as it had been stated tonight. The survey was back when the guidance was going to be 10 students per CDC guidelines, and then the CDC guidelines for safety, but the recommended 10 students. So the choices, and this was a preference test. So the choices were 100% in person, a hybrid model, or 100% remote. And these were the survey. This was a staff survey. We had 281. Their first preference was in person. And the first, we had 93 that said their first preference was hybrid, and 87 that said their first preference was 100% remote. Now, I understand, like, what I'm getting ready to share now, which I can't seem to move my slides. Okay, so this survey is completely different that we just put out to staff, and so we're not, this is apples to oranges. I just wanted to tell you, like, back early when the guidance, and we asked for what that was, but you can see there is quite a bit of difference. So this, you can see the question right on the slide. Please indicate your comfort level with returning to school based on the current plan with regard to health and safety measures. So this does speak to that our staff is not comfortable. And I do wonder if once we, our staff gets back into the schools, we, go over the protocols, we have our training sessions, we get to practice because, we'll be on site. If, to Terri's suggestion to have another survey, would this start shifting, right? And it goes back to Dr. Parkinson about when you're uncomfortable, he starts reading. And that's what I do too. I spend a lot of time on the weekends just reading the science that's out there. And so I wonder if this will shift, but I wanted you to see this now because this is the current state of for our staff.
Lori, could you just tell us what the 1, 2, 3, and 4 were?
Yes.
Is it very comfortable? Okay.
Yep. 1 would be the least comfortable, 4 would be the most comfortable. Thank you for that question. And I can't see people's faces, so please just ask questions. I won't see your hand, so I'm doing this. So this one was about, we also wanted to know how they felt about the teaching and learning practices. Trying to ask the question, knowing they haven't had the professional development yet around, some people have. We certainly have had over 100 people participate over the summer. And we were able to do some during those days back in June. But you can see the results of this as well. If you look in the center here, where it seems like that, it's kind of the middle of the road, we do have the majority. We have some people that are really feeling comfortable, and we still have some work to do, and that's okay. That's what we have, the 10 days of professional development around the practices. So a balance between the safety and, and our teaching practices. Again, if we do another survey after that, will we see, some improvement there? And we certainly hope so. I'm going to shift to the family survey now, knowing that we've asked the families to, they have through tomorrow to fill out the survey. But this was as of late last night. I'm going to share there were 1,982 responses as of last night. And this slide right here, again, the 1 to 4, and it was the same question. And, 1 being least comfortable, 4 being the most comfortable. And this is the elementary grades. Now I'm breaking it down from, pre-K to 4, and then I'm going to do 5 to 8, and then I'm going to show you the high school. Because the models are different and the age groups are different, I wanted to break this down in this way. So you can see that this is like this preliminary.
Lori, can I just ask, this question was what? It was how comfortable are you sending your kid to school?
Yes.
Okay, thanks.
Based on the health and safety.
Based on health and safety, okay, thank you.
Like that first question on the other. So again, this is the elementary, and we have just about 2,000, so 2/3 of our families right now that has done the survey. Now, this is still elementary. Now, this is a different question. We asked them to certify if you are going to be in person or if you're going to be remote. And so the blue is the in-person. We have 584 in right now at the elementary level that want to be in person, 168 that's choosing remote. I'm going to move on to Morse Pond and Lawrence. Again, this is the based on the health and safety. How comfortable are you sending your children to school? And you can see one least comfortable, 4 being the most comfortable. So you can see the results at this age level. And then this is asking them to certify, will they be in person or remote? So we have about 551 saying in person and 143 remote. Now move on to the next one, the height. Oh, what happened? I hit it twice. How do I go back? Here we go. Okay, sorry about that. So this is Falmouth High School. And again, the same question about health and safety, having your children return to school for in-person learning. And you can see where the slide is there. And then right now we have 450 families saying that their children will come in person and 86 will be remote. So I just wanted to give you a kind of a overview right now where we are. Families know that that they can shift, right? That they can move to, if they're remote, with a little bit of notice so that we can plan and make sure that we can get as much safe distance as possible, that they can move to in-person can move to remote as well. But what we ask is this is for the beginning of the school year. How are we going to start so that our principals and their teams and their buildings can better plan for each of the classrooms?
Lori, is the breakdown that you're seeing remote versus in school, is it similar to the initial numbers or is it completely different?
So that's an excellent question because that was actually next. So that actually totaled up that 20% is asking for a remote situation and 80% in person. And that actually aligns to the survey in the spring. Not the initial one that I reported to you, but the second one where we kept working to get more families to, and we had almost, but maybe 100, 150 that did not do the one in July. And so this is actually holding steady with those results.
Okay, just because, we planned based on that. So I'm just asking.
Exactly.
Leah.
I have a question about that switch, Lori. That's something in my job we've been grappling with. So we have decided that it's a marking period that families need to commit to. Does Falmouth have a time period? I know how tricky this can be with bringing kids back into classes, especially when you have cohorts established.
Yes. So we are planning for more students than we actually, the data is actually saying coming in. So we're comfortable with that. And the team talked about it with a 2-week notice, they can come back, right? Giving us 2 weeks, we'll figure out whether they need busing, we'll figure out, the seating and making sure that, everything's safe. We have, whatever is needed. It may not even take 2 weeks, but I'm just saying we would like to have that buffer to do that. So I have heard that other districts are doing it by marking period, but we felt like, if things really, if things improve, it's quite a few weeks for kids to be able to wait or parents to wait if they feel comfortable, if they become comfortable to have kids back in person. So we did go with the 2-week notice.
Terri.
In anywhere of that coming back scenario, it would never change schools though, would it? You have enough numbers that kids wouldn't have to change schools, correct?
Correct. No, they would right now, everyone's confident that they will go in with the teacher that they're starting with, like the remote teacher. So when they come in, they'll be in the same class with the same teacher and be able to integrate into that classroom.
Andrea.
Lori, I was just, I was checking to see if I wrote down the number of responses correct. So it seems like we're still missing a lot of responses, which I know is critical for your planning purposes.
A little over 1,000, but they have till tomorrow. And I know that even after tomorrow, we'll be spending the rest of the week, reaching out, calling families and such. And we did, so to all the families that English is not the first language, we mailed home the survey in their language. So we're collecting those as well. So, yeah. So we know that those will be coming in.
Okay, great. Yeah, because I was, thinking a third being outstanding is pretty important for you guys to be able to do that. So I'm glad you have that buffer built in as well. So.
Lori, I know we started asking questions. I wasn't sure whether or not did you get to hit every point that you were hoping to touch on?
I believe so.
Before we started? Okay. Are there any other questions for Lori? All right. Thank you so much.
Thank you.
Appreciate it. Okay. Our policy folks thought that they were off the hook when they put together the incredible policy manual for this year, and now they're back at it. So 2 items for COVID-19 related policies, and I acknowledge that, not only do we usually have a first read, a second read, and then we act on them, but not only are we not doing that because we have to because of timing, but most people got them, today, if you weren't on the policy sub. So acknowledging all of those things and still recognizing that we have to move forward because we have to have these in place to start school. Sonia, are you going to walk us through these, or is someone from policy going to walk us through these so that we know what we're voting on?
Yes, I will take you on that short journey this evening. So policy subcommittee met last evening. This was the second of 2 back-to-back meetings to try and work through model language that was proposed to us through the Mass Association of School Committees through their model policy manual, and that we have looked at both through the lens of our plan for returning back to school, as well as comparing it against existing policies that we have from our comprehensive policy review. So thank you for setting the stage. The first I'm going to share with you is the one that's listed as EBC. Oh, it's not what I clicked, but trying to share with you EBC supplemental. I'm clicking share, and it's showing me face covering.
There we go.
Right.
We got it.
Okay. I think all of our computers are timing out. Okay, so I'm going to walk you through this one, but unfortunately, in order to be able to do that on the screen, I have to collapse the visual images. So if somebody's trying to ask me a question, I do ask that you just ask it outright, because unfortunately, I can't see you at this moment.
And I can't see everyone either, so we'll just talk, over each other carefully.
All right, thank you. So in this particular policy, there is preface language at the beginning that starts by making a statement around the school committee noting the COVID-19 pandemic and that it has disrupted the traditional school day and school year. And it has concerns related to students, families, and the community, and a growing number of issues that are ultimately affecting public education, as we've discussed at length this evening. Therefore, the school committee is establishing an emergency interim policy for the purposes of promoting public safety and safety of students and faculty, maintaining to the extent possible the high and efficient level of educational services for which we're known, ensuring support for students in general and in particular for those at highest risk educationally, as well as those at social and economic risk, and being sure that we comply with the emergency orders of the governor and adhere to the extent possible to the guidance of the Department of Elementary and Secondary Education as our governing board and other agencies of state and federal government, and expedite the safest strategy for returning our students to school. Through this policy, the school committee confirms that it has approved the final plan, which is submitted to DESE, which outlines strategy for returning students to school, and will, in collaboration with the with the superintendent, make such modifications to the back to school plan. And Lori already alluded to updates are made available on the site as soon as they're made. The school committee will authorize the superintendent to act expeditiously in executing the back to school plan in accordance with current law and regulation, and will, where noted, authorize the superintendent to suspend, revise, or recommend policies, rules, and protocols as needed to serve the best interests and safety of students, their families, and the community. The superintendent will designate appropriate staff members to oversee the staff administration of COVID-19 related policies during the period of the pandemic emergency, and shall make such recommendations to the school committee as needed. The back to school plan shall constitute the policy of the district during the pandemic emergency, and the superintendent shall exercise the authority provided in the law to carry out the plan as needed. So it follows through the general district goals affected by the pandemic. The superintendent, with the advice and consent of the school committee, may suspend or modify individual district policies to address the COVID-19 emergency as declared by the governor. Such suspension of policy shall expire upon the end of the emergency as declared by the governor. And the goal of the emergency pandemic policies shall be to ensure the safety and health of students, faculty, staff, and all persons who may come in contact with them, provide the most effective educational services as possible to students under the circumstances, authorize changes to operating protocols as needed to open and operate schools effectively from various venues or platforms, conduct the district business and operational functions as efficiently as is possible, allow the superintendent and staff to act quickly to carry out the back to school plan, and facilitate the reestablishment of a safe and productive school day and school year. So as we move into the remaining pages, the remaining section of this particular policy, I want to remind you that it has this supplemental file name, because it's going to touch on a whole host of policies. And this is not taking those policies out of their active state, but it's speaking to specific elements that are touched on and how they relate to our response to the COVID-19 pandemic. So where possible, if there's one file name, if there's one set of call letters, we've provided the specific name of the policy. In some cases where there are multiple call letters, it's a general heading that tells you why all of those different policies are being brought together and coordinated under the heading. So the first is the assignment to schools. Subject to the guidance from DESE, superintendent may suspend or revise the assignment of students to schools, including the assignment of new students, for such a period as the emergency declaration is in force. Again, then following with the school year school calendar, subject to the guidance from DESE and the provisions of collective bargaining agreements, the superintendent may suspend or revise the school calendar with the approval of the school committee. A little foreshadowing for our next point of discussion. Time on learning. Subject to the guidance again from DESE and the provisions of collective bargaining agreements, the superintendent may suspend or amend requirements for time on learning for the duration of the COVID-19 pandemic. Promotion and retention of students. In accordance with the guidance from DESE, the superintendent may propose, subject to the approval of the school committee, modifications to the policy of the district for grading and retention of students. Conditions to receive a diploma. In accordance with guidance from DESE and modifications to current regulation or law, the superintendent may propose, subject to the approval of the school committee, modifications to the policy of the district regarding graduation requirements. This is one that speaks broadly to special education and ties a handful of policies together. In accordance with guidance from DESE and modifications to current regulation or law, the superintendent may propose, subject to the approval of the school committee, modifications to the policy of the district regarding graduation requirements. The superintendent and school committee should be mindful that attainment of a high school diploma may render certain students ineligible for further services. Discipline and suspension or expulsion with continued access to education. The superintendent or designee shall create protocols for serving students who are disciplined or suspended during the COVID-19 pandemic. Again, making sure that their educational access is not disrupted. Student welfare. The superintendent shall provide protocols to principals and teachers regarding students who may require special exemptions from health and safety standards during the pandemic emergency. Such protocols may address exemption for utilizing support animals. Professional staff positions. The superintendent may revise job descriptions for district staff considering the provisions of current collective bargaining agreements in order to secure the safety and health of students and staff, establish effective communications between school and community, maintain facilities, transport students as needed, provide food services, and acquire necessary materials to operate schools safely and securely during the pandemic. The superintendent will inform the school committee of any such changes, and any changes to job descriptions shall expire at the end of the declared emergency situation. This is one of the umbrella sets, students at risk during the COVID-19 pandemic. The superintendent may revise or suspend provisions of policy to facilitate the education of students at risk or with special physical needs or their family caregivers, including but not limited to caring for, educating students with disabilities, illness, pregnancy, child rearing responsibilities, or special education needs consistent with law and regulation. Student records. During the COVID-19 pandemic, the rights to privacy held by students and their families shall not be abridged by the district. Such rights extend to the confidentiality of student academic records, health data, economic status, and other such information as may be considered confidential by law. The Falmouth Public Schools strictly prohibit students from taking screenshots, pictures, audio and visual recordings, and distributing of any virtual educational experience. Students agree to engage in virtual educational experiences in a quiet, private area to the extent possible and to protect student confidentiality. Co-curricular and extracurricular activities, subject to law, regulation, and standards established by the appropriate and legitimate regulatory body, the superintendent may propose changes to district protocols for participation in extracurricular activities, including sports, subject to the rules established by the Massachusetts Interscholastic Athletic Association, or the MIAA. Student absences and excuses. Subject to operative law and regulations, the superintendent may suspend, modify, or adapt policies related to student attendance and absences when appropriate, including the link between attendance and grades, chronic absence policies, and accommodations for students requiring specialized placements. Subject to law, regulation, or emergency declaration, the superintendent may propose protocols, modifications, or suspensions of district policies regarding attendance by students or the public in school events, including but not limited to assemblies, sport events, large gatherings, or other programs. Visitors to schools subject to current emergency declarations, the superintendent may propose suspension or modification to district policies regarding visitors to school buildings during the school day and after school hours. Communicable diseases. Subject to the provisions of the back to school plan, the superintendent may establish protocols for contact tracing. Such protocols will be consistent with law, regulation, and standards to protect the privacy of students, their families, and other persons. Again, an overarching transportation and busing. Subject to current law and regulation, the superintendent may suspend or modify policies related to the transportation of students by the district. Legal requirements relating to IEPs that contain transportation for students shall not be altered without appropriate family consent. These modifications shall be consistent with the district's back to school plan. And finally, operations and facilities maintenance. Subject to the provisions of law, regulation, and collective bargaining agreements, the superintendent may suspend or amend current policy to ensure the efficient operation of business functions and maintenance of school buildings and other such offices as the district maintains. So this is the long running list. I'm going to very slowly scroll back to the top of the policies that are being touched by the provisions of this supplemental policy. With relation to our very specific response to the COVID pandemic, and any language stated in here would sunset or cease when the state of emergency is lifted by Governor Baker.
Thank you. Does anybody have questions for Sonia or the policy subcommittee? Sorry, I'm trying to move it so I can see everybody.
Here, I can do this for a second.
Oh, that's better. Thank you. Does anybody have any questions on it? The only thing I was concerned about is when it's going to end, but it's built right in there. So thank you for including that line. Okay. Last call. All right. So is there, I think, Terri, go ahead.
No, I was going to make the motion, but.
Thank you. That's what I was going to ask.
Jump ahead. I'm sorry.
That's great. So is there a motion to act on?
I'll second it.
Thank you. And we're just going to do them one at a time. And I missed who did it and seconded because I wasn't looking up. So I'm sure. Melissa, did you get it? No.
It was Andrea.
Andrea, thank you. Terry, and then the second by Andrea, and it's a roll call vote. And Leah, you were first.
Leah Palmer, yes.
John?
John Furnari, yes.
Andrea?
Andrea Thorrold, yes.
Melissa?
Melissa Keefe, yes.
Terry?
Terri Medeiros, yes.
Lisa?
It's a Hart, yes.
Bill?
Yes.
Natalie?
Natalie Kanellopoulos, yes.
And Kelly Welch, I'm also a yes, so that passes unanimously. And thank you guys for that hard work of getting back to, such a lengthy policy thing. The second one is on face coverings, EBCFA.
Sonia, can I just ask a question? I'm so sorry I was not there for the policy subcommittee meeting yesterday. So these two policies, I was just looking at like them compared to mask policies, and they seem to be identical. Is that right? Or
there are a couple of places where we either adjusted the language to match what was in our policies, or there are also a couple of places where we took a couple of the suggestions out because they were already covered in multiple provisions with our return to school plan and other policies.
Okay. So I do have a specific question when you go over this one. So.
Okay. And if you don't mind sharing your screen again, just because the public hasn't had access to this. So I just want to make sure that we are as open as we can be.
We get the right one came up. This is good. Okay. Face coverings. The Falmouth Public Schools is committed to providing a safe environment as schools reopen during the COVID-19 pandemic. According to public health experts, one of the best ways to stop the spread of the coronavirus and to keep members of our school communities safe is the use of face masks or face coverings. Therefore, with consideration of guidance from the Center for Disease Control, the Department of Elementary and Secondary Education, the Massachusetts Department of Public Health, the district's consulting physician, and the Falmouth Town Health Agent, the following requirements are in place until further notice. A multi-layer face covering that securely covers the nose and mouth must be worn by all individuals in school buildings, on school grounds, and on school transportation, even when social distancing is observed. Individuals may be excused from the requirement for the following list of reasons per CDC guidance if the individual has trouble breathing, is unconscious, is incapacitated, and or cannot remove the mask or face covering without assistance. Exemptions to this policy under certain circumstances, such as for students with medical, behavioral, or other challenges who are unable to wear masks, will only be granted by a physician's completion of the request for face mask medical exemption form, which requires the physician's signature to be considered complete. Parents or guardians may not excuse their child from the face mask requirement. Additionally, face masks or face coverings will not be required when appropriate social distancing is enforced. Examples include during mass breaks, while eating or drinking, or during physical education classes. A student's mask or face covering is to be provided by the student's family. Staff members are responsible for providing their own face coverings. However, the district will supply disposable face coverings, that should be plural, face coverings for individuals who arrive at a building or board school transportation without one. If students are in violation of this policy, the principal will first contact the parents or guardians to issue a warning and inform them that continued noncompliance will result in the student being transitioned from the school building for in-person learning to the remote learning model until such time as they can comply with the requirement or the requirement is lifted. Violations of this policy by staff will be handled in the same manner as other violations of school committee policy, procedures, administrative directives, and professional expectations. Because violation could endanger the health and safety of others, staff members failing to wear face coverings as required will be issued one written warning. Should a second violation occur, staff members will be subject to additional discipline up to dismissal. When visitors are permitted in the school and district buildings, those in violation of this policy will be denied entry to the school or district facility. This policy will remain in effect until rescinded by the school committee. Legal references include the COVID-19 Order number 31 from the Commonwealth, and then followed by additional references to both the CDC, Mass DESE reopening guidelines, and the Mascot, Massachusetts Commonwealth publication.
Leah, you already said you have a question, and I can't see anyone else. So do you want to start with your question?
Yeah, I was trying to find the document. So the commissioner came out with guidance around physical education. So my question for this, to first ask that, is around that, just that blurb around not wearing the mask during physical education. And I just automatically didn't feel necessarily comfortable with that. And then I was trying to find the guidance document that came out from the commissioner around that, with the dance and physical education and music pieces. What does that document say around wearing masks for physical education?
Distance at greater than 10 feet.
Without masks?
Yes.
So it does not recommend masks?
If social distancing guidance for 10 feet or greater cannot be followed, right, then that would be where.
Okay, so I guess my recommendation would be maybe putting that in, just so we have that clear. Because the way it reads right now is that during physical education, that might be a time where you don't have to wear masks, but it does have that stipulation that it's at least 10 feet apart, right?
So is that not include? So the sentence before says appropriate social distancing is enforced. Is that what that's referencing?
Yes. Because each of in the examples that follow, each of the examples comes with a different social distance guideline.
Of course.
So
included.
Yeah. So you know, at the risk of getting into wordsmithing, so additionally, so face masks and coverings are not required when appropriate social distancing is enforced. And are these the only examples that we have, or are there other items as well that we don't, that we're not listing but may have social distancing requirements? I don't know if I'm being clear. I'm just wondering if this is an exhaustive
Do our
list.
cross references not cover that question? About what is considered proper for sports, and don't our references cover that?
The references that are at the end cover that?
They refer us back to CDC guidance and then the Massachusetts Department of Ed reopening guidelines, which is where each of those is classified.
Okay.
Yeah, I guess that just the eating and the other piece that was in there, that's at a 6 foot, and then the PE is at a 10 foot. So there is a difference in the social distancing.
I guess my worry is that if we don't rely on the reference material and instead we rely on the language that we build in, if the reference point changes, so let's say we approve this and we've added in, you know, 6 feet for lunch and 10 feet for gym or whatever, and then in a month the CDC says no, it's 12 feet for gym and 3 feet for lunch or whatever, do we then need to, if we're referencing a specific source, are we okay with that, or do we then, if we put it in there, are we going to have to keep coming back?
No,
is that
that's why in general we keep procedures out of policy, because they can change. So these are procedures. So we say a lot of times we want to be as vague as we can, but if you give those cross references, like sometimes we leave things out of policy that are in student handbooks, for example. So am I right in this, Sonia?
Yeah. Yes, that was the discussion during our comprehensive policy review.
Yeah.
So this was an intention, the reference materials were an intentional decision to keep the numbers and specifics out of the policy.
That's our general philosophy.
Okay, that was a question. I don't know why I said it like a statement. Yeah. Thank you. I just want to make sure I understand.
Natalie,
I'm sorry, Natalie. Yep.
No worries. I just, to avoid any potential confusion, is there value in listing the face coverings that are not approved in this section?
We had that conversation yesterday. We were talking, for example, about if you say that gaiters are not allowed, and then suddenly people are producing multi-layered gaiters for this, the same example is the word coming to mind. Sorry, I'm trying to get my thoughts together. For the same rationale that Terri just shared, I think, you know, if you say no gaiters and then gaiters are made available in 2-ply, and that tends to be what some of the younger students are wearing. Like, we had that whole conversation yesterday too, and then ultimately decided not to include that.
Gotcha, thank you.
John.
Yeah, so I mean, it mentions that the staff are responsible to provide their own masks. I assume that they're coming in, you know, daily, they have to have their own mask, but the mask that Joan had showed with the Falmouth logo on it, will the staff get at least one of those just to distribute it, and then it's up to them to bring the mask each day? I mean, because we can spring for at least one mask for our staff, I would think.
I would hope. I think Joan said yes, Joan.
Okay, good.
Yep, she shook her head.
Thank you.
And
Thank you.
for students, that mask is everyone, and so all staff and students will have that.
Outstanding, thank you.
And I would hope also that if, everyone's got theirs, that's so sweet. That, you know, we also, I would assume, although I'm going to say it out loud anyway, to not assume that, you know, we are going to have families that truly cannot purchase these. So I'm assuming we will cover our families that we know just don't have the money to be springing for a set of 5 masks.
Just to follow up to that, Kelly, I know with how creative our teachers are in our support group, they'll probably have things of their own that are kind of making it fun and try to break the ice with the students and whatnot. So I'm not expecting it to be like a issue that they'll have, but I do think it'd be nice to have at least one to begin with. Thanks.
Yeah.
So we actually have many volunteers that are making masks. So for families that may need them. So we're going to have mini masks that are fun and colorful, and we definitely have the disposables that we'll have plenty of those whenever needed, but we're also trying to make child size and adult size masks for our families. So we'll have masks to give. That was done early on, starting in the springtime.
Thank you.
Can I ask, or just add one more thing? We missed one, changing the social distance to physical distance. We've been trying to be very clear in picking that up, and we just missed one. Can we just make a blanket? I don't want to wordsmith and go through it, but wherever it says social distance, use physical distance. We've trying to been careful. I know a lot of the mask policies use the social distance, and so just wanted to identify. I just noticed that when we did it. Okay.
Okay.
Thanks.
Any last questions for Sonia? Is there a motion to approve the EBCFA with the one change of social distancing to physical distancing wherever it appears? Terry's got that motion, and is there a second?
I'll second.
Second from Lisa, and any last questions?
Well, actually, Kelly, not a question, but more so implementation. This may be as good a time as any to kind of squeeze it in. Any way we can have, the more signs, the merrier, I think, to remind people to wear masks. There's a great website, the Cape Cod Reopening.com or something, I think it's called, which has some tremendous masks that I've used, and it's been very effective. There's a lot of fun ones that are geared towards kids. I'm sure there are other resources, but the more, I just find that signs really help. And I'll go back to the regular motion here. I just had to squeeze that in somewhere.
No worries. Yeah, it's totally fine. So it's a roll call vote. Lisa, you're first.
Lisa Hart, yes.
Andrea?
Andrea Thorrold, yes.
Leah?
Leah Palmer, yes.
Melissa?
Melissa Keefe, yes.
John?
John Furnari, yes.
Terry?
Terri Medeiros, yes.
Bill?
Yes.
Natalie?
Natalie Kanellopoulos, yes.
Kelly Welch, I'm also a yes, so it passes unanimously as well. Great. Thank you to Policy Committee. We're getting there, guys. Hang in there. Next is acting on our revised 2020-2021 school calendar. And, you know, I want to preface it by saying that, you know, as Lori Andrade mentioned, you know, we're still working with the union on some of the pieces, but we do feel like we've reflected in this version the things that they have asked for. So we're hoping that that will be the case. But I'm going to remind you that this is not really the school committee's job to get into the minutia of what every day looks like. That's managerial. So the pieces that we're going to be looking at voting on tonight will be the additional 10 professional development days that the commissioner has, I don't want to say dictated, but encouraged us to use. The actual first day of school is then moved because we've added the 10 PD days. So the first day of school would be moved to this September 21st. And the elimination of two, or not elimination really, we're just moving them probably to later in the year, but certainly not having them in the middle of all the chaos, the early release days that we traditionally have in September and October. So that's what we're looking at for calendar changes. You know, when we voted this calendar a year plus ago, we had no idea that we were going to need to make these. So I don't know, Lori, did you want to share the screen? I think everyone saw it. You know, where's everyone? Oh, there we go. I don't know if everybody had it in front
Yes,
of them
there's
or not.
more on the calendar, but I did think our families and staff may want to look at. We moved the first PD day here. We'll start out with safety training on the first day, and we wanted to do that before we actually came back into the buildings. Then these 2 days, the classroom setup. We moved those over a day each, and then basically because those are the district days, then we pick up back on the 10 days day through 2 through 10 in a row here. This reflects the 9/21 that we're proposing. That would be our start date. The first week would be a remote learning week. Specific schedules would come out from each school. The next week we would do half days and a reduced number of students on each day. The students that are home would be learning remotely, and then in the afternoon students would be remote as well. The half days would be a Monday, Tuesday, Thursday, Friday, Wednesday, remote for everyone. This remote day is just part of the staggered bringing students in. You mentioned the half PD day that we are asking as part of your vote that you would reschedule. The 10th through the 8th would be the other week, 4 days of the half days, reduced number of students. And I do want to point out in both, it really takes 2 weeks in a schedule since we have the hybrid with cohort A in 1 week and cohort B in the second week. So it really takes 2 weeks to get through that schedule. You'll see there's 4 days here for the first cohort in the hybrid, and here's the 4 days for the second hybrid. During those days, we are, again, just something for you to be aware of, that our students that would be in every week would also be in all 4 days here and all 4 days here. So there are some students that will be in full time. And then this is an already scheduled PD day on the 10/9, and we did leave it. We thought that after we had spent 3 weeks that before we get the established model, the teachers would have an opportunity to have that district PD day. We have a holiday on the Monday, and then we are proposing that the established model begins on 10/13. 10/20 is the other half day that we're, as part of your vote, we're asking that we would reschedule that. And then remote Wednesdays has been something as part of the schedules that I put out to the families that Morse Pond, Lawrence, and the high school have built in for grades 5 to 12. I did put out as part of the survey with the families about the Wednesdays being remote for elementary. I just want you to, we're still in discussion with FEA about the remote Wednesdays. So that piece has not been decided. But as Kelly said, that's not a part of what you're voting. I'm just sharing that so that our families and staff that's watching, you know, knows what's going to happen and what's still that needs to be discussed. So again, the 10 PD days, the 9/21 start, and the 2 half days for reschedule.
And I appreciate, Lori, you sharing the extra details, because I do think, you know, families, they're desperate to know what to expect. So I really appreciate it, even though, you know, it's not in our wheelhouse, really. Terri.
One question about, perhaps Mary Gans will do this, whether you are in cohort A or B, you need to know which one you're in to know when you physically start, right? And they'll find that out.
Yes, so that's why we're trying to get the surveys back. We can actually assign students to seats on week A and week B. And our goal is next Friday, September 4th, to let parents know, which is about what we do every year anyway. So so parents usually know what the assignment is about 2 weeks before school starts. And since we have the delay to 9/21, or the proposed 9/21, is that, you know, that's about 2 weeks. So that's about the normal not time, but we're really trying to push through this. So principals will have that information by next Friday to share.
Phil, did I see your hand pop up?
Yes, you did. Full-time students, we talked about IEPs and special needs students. Are they going to begin the 21st?
So the week of the 21st is remote for everyone. And then the next week would be when, so they would come in all 4 days. They would not come in at the reduced, you know, being half of the students, and then the next 4 days as well.
Okay, so those students then would start 9/28.
Yes.
Okay, and the other thing is the 10 days professional development, and then you're beginning of remote learning. The anticipation is that all teachers will be in their classrooms.
So that's one of the negotiating points, Bill, that we've discussed. One of the points that's still open for discussion.
Okay, thank you.
Andrea, then Leah.
So 2 questions. One is just one of those management pieces in terms of when the half days start. It says a reduced number of students. Is that in the hybrid models? Is that a reduction of the number that we're supposed to be there for the hybrid?
Yeah, for the hybrid and for the elementary. So it's approximately half, right, of the students that would be there, but then we do have some students that are, well, in the elementary are full-time anyway, but so it'd be half days and half the students on Monday and Tuesday, and on Tuesday, Thursday, it's half days, and it's the other half of that cohort students. And then,
okay.
So very small numbers to start out, and we're really trying to think about, you know, staff having those very small numbers to review with the small groups on what the protocols are, to practice those. Just part of that, you know, just really slow start, you know, in small numbers to be able to go over all of those protocols. We're hoping that that is a step that will also help our staff feel comfortable, much like the summertime, right? So if there's normal 10 students in a cohort in the hybrid, right? 10 one week, 10 the other, you're going to have 5 students, right? So that mirrors a lot like what the summer would be, and the teachers felt that that was manageable. So at least getting, you know, 2 weeks of that with the 2 days with each one of those small groups would be very helpful.
That makes a lot more sense because I couldn't figure out how everybody was getting in with just the 2-week cycle. So that's great. The other question is just a clarification on the dates that for professional development that we're rescheduling. We're voting tonight to reschedule them, and you'll come back to us with those dates and we will actually reschedule them.
Yes, so we hadn't got that far. We were getting just the September, October down right now and trying to get this out so that families would have the calendar. So we would like to work with FEA on talking about like where the best opportunities, through the rest of the calendar where they may go. And then there's still the reschedule of the other district day that's in the beginning. So we had agreed to put the first PD day in a slot where the district day is, because we weren't supposed to be banking in any of the PD days. So we have 2 half days and a full day to look at the rest of the year calendar that we will bring back to you.
Okay, great, thank you.
Leah?
I actually think that you answered that. I was just wondering about the pre-K through 4th grade and what that looked like for those days. So just a clarifying question. So it would be, if I was a 1st grade teacher, I would only have half of my pod of students?
Yes.
Okay, and so then I'd have the other half the next 2 days?
Yes. And then for the elementary, because they're not in the hybrid every other week, you would have those same groups of students both weeks.
Okay, so a parent would get notice saying for those 2 weeks, your child will be coming to school Monday and Tuesday from 8 to 12 or whatever. Is that right?
Yes.
Okay.
Yeah, you got it.
Any other questions on this? John?
Yeah, I mean, I think I have a lot of confidence in the administration and the FEA to make it happen. We as a school committee, we really need to give them both the tools to do so. And that's what I feel this calendar does. It's saying, okay, let's move forward. Here's how we're going to move. On a note of, in talking about, I think it'd be very helpful. It's not necessarily related to that we have to have something now, but from the 21st moving forward, I think it would help families a great deal for the hybrid model to have, in addition to the regular calendar, to also have from now, from the 21st of September through December 31st, you're in cohort A, here's all of the days that you're in school and you're in cohort A, here's all the days that the weeks, that you're going to be remote. And I think having sort of like and if it was on like an Excel spreadsheet, even having like a toggle switch, if you will, or to where you're going from, looking at one version or another, or just having on one side of a paper and on the other side of the paper, I think that would help people visualize and do their, family planning and whatnot too as well. Just thought I'd share that.
Thank you.
Thanks. Any last questions about that? I hesitate to ask to promote Ms. Jazzo because I see she has her hand raised, but I also don't know how long it's been up. And we might be in the same predicament we were before. But can we try and promote her and hear if she actually has a question?
Hi.
Oh, great. You're actually there. What's your question, Ms. Jazzo?
I was just back when you were talking about the 10 feet distancing, and I just wanted to clarify that for singing, it's 10 feet distance with a mask.
Oh, thank you. So I'm glad we kept that as the reference material instead of just putting in numbers because we would have had it wrong. I'm sorry I didn't notice that you were had your hand up all that time. I apologize.
No worries, just trying to help.
Thanks, I appreciate it. John.
And Kelly and Miss Jazzo has a good sense of humor, so I have to say that since she's a music teacher too, if she had with a jazz hand that she had up. I had to say it. I'm sorry.
It does kind of look like a hand. You're right. Okay, so I've already forgotten where we. Okay, so we need a motion. Is there a motion to approve the 10 professional development days, the first day of school, and moving the September, October early release days to be rescheduled later. I know it's a mouthful, but.
I'll make a motion to approve the calendar as Kelly just said.
Thanks.
I'll second it. John's
John's got a second. And then any last questions? Andrea.
I just want to add in that that was also the district professional development day, as well as the 2 half-days.
Oh, yes, thank you. Good point, good catch. So it's the 10 professional development and our professional development day. Thank you for catching that. Any last comments?
I just have one last comment about that.
Yeah.
I just feel that we need to be really flexible with those days. So Lori, I don't want you to feel pressure that you have to schedule that, because we don't know what it's going to be like. And I just think that it's really nice to have that buffer of those 3 days for when you need it. So I don't know. That's just my opinion. I don't feel like you have to work on scheduling that right away.
Thank you. Appreciate that. Everyone will appreciate that.
It's a roll call vote. John, you moved on my screen, so now you're first.
John Furnari, yes.
Andrea?
Andrea Thorrold, yes.
Leah?
Leah Palmer, yes.
Melissa?
Melissa Keefe, yes.
Lisa?
Lisa Hart, yes.
Terri?
Terri Medeiros, yes.
Bill?
Yes.
Natalie?
Natalie Kanellopoulos, yes.
And Kelly Welch, I'm also yes, so it passes unanimously. Thank you. Okay, so I'm paying attention to the fact that it is 10:30. So on our next item is the first read on our equity and diversity coordinator job description. And we always have another read on this. So I don't know, Lori, if you needed to give us any heads up information, but I'm going to suggest that people read through it and send their questions to you and or me. And then we have a more I feel like if we try to have a conversation about it now, we're not going to do it justice. I would rather have a more robust conversation when we're all awake.
Yeah. So what I like our plan to be, if they could go to Joannie.
Oh, sorry.
He was going to go to
sleep like a third grader. It's 10:30 at night. This is way past my bedtime. And now I'm getting pushed to the next. I don't understand.
I'm sorry. I don't feel like we're going to do it the justice that it.
I do. I'm like blinking one eye at a time here, but
I know.
I understand it. I completely respect that. I think that the only thing I want to say is that the Affirmative Action Committee and members of residents of the town of Falmouth worked really hard and focused to get this position, the warrant out, and get it in front of the Board of Selectmen as well as the school committee. And now that it's jointly funded, I think working at making sure that there's inclusion in the creation of the job description beyond the duties that were presented when the warrant was submitted. And so what you see here is essentially the duties that were in the warrant, in the format that we need to have it in order to have a job description, but also the Director of Human Resources for the town, Denise Coleman, and myself also went through it and looking at how this third position in the town dovetails to her position and my position, so that we can work in concert and really be formidable in terms of approaching equity, diversity, inclusion. So yes, take your time, give it a good read, and I'll be more than happy to come back for another 4 hours at the next meeting.
I'm sorry. Well, you would have to anyway, because we still have to, it's just a first read. So we're going to bring it back no matter what.
Kelly, I just wanted to also say, next time, not only, we're going to do a public hearing so that we can hear this. So we want to post this and get feedback from the community on this posting so that we can incorporate any feedback, and then have you vote it next time. So I just wanted to, so not only should you read it, but just know that you're going to get feedback from the community. And I just asked that, to be ready to kind of absorb that and make any adjustments you may want to as you vote.
Yeah, it gives a lot of time also for the Affirmative Action Committee to make sure that the word gets out and all the varied stakeholders with diverse backgrounds can have a chance to add their public comment and shape the position.
So by pushing our first read, or pushing off our conversation about it, we're not going to hold up the process. Okay, that was my main concern.
I think it actually helps because it gets the word out more.
Okay, good. Leah?
Kelly, can I just make one comment? Just so, Joanna, you feel like your purpose is here. I really appreciate the three components that I see in this job of mediation, of training, and of community building. So just so you know that I read it. So it did have a first read. So
it did. I mean, I'm sure we all read it, but I know that there's going to be conversation. Okay, so thank you for your understanding on that, and send your questions to Giovanni. Next is approving our minutes from our August 6th meeting. Is there a motion to approve the August 6th minutes?
I'll make a motion to approve.
Thank you. Is there a second? Melissa's got it. Any questions or edits? It's a roll call vote. John?
John Furnari, yes.
Andrea?
Andrea Thorrold, yes.
Leah?
Leah Palmer, yes.
Melissa?
Melissa Keefe, yes.
Lisa?
Hart, yes.
Bill?
Yes.
Natalie?
Natalie Kanellopoulos, yes.
And Kelly Welch also a yes, so that passes unanimously. I only have two quick things. One, thank you to everyone who volunteered for the safety committee. I have not figured out what to do about that yet, but I appreciate you volunteering, so stay tuned. And the second is to thank Natalie for sending about 8 million email responses over the last month, and I really appreciate it.
You're welcome.
It's nice for people to get such tailored and thoughtful responses. Are there any other committee member updates? Bill, did you have something?
Not updates, but a follow-up, if that's okay.
Yeah, go for it.
Follow-up is we've obviously dealt with teachers, we've dealt with students, we've dealt with education, curriculum, hybrid, in-person, remote, all those things. I think next committee meeting, we should have an AD here speaking to us about the beginning of sports. I know it's been put off to September 15th, but I think we all have some questions on that and would like to know how it's going to be organized, how it's going to go forward, how you're going to schedule, how you're going to transport, what kind of contest are you going to have. And I think football and possibly gymnastics, I'm not sure if we have that, but football obviously I think now is going to be moved to more of the spring. And just to kind of update us on that whole aspect, because I do think it's important and is a big part of the educational system.
Thanks. Appreciate that. Any other requests or committee member updates? Leah.
I'm sure we will get this, but a request for the HVAC information. And then I guess as much as we could get a sense of what the protocols are as a committee, I'm sure, Lori, you're planning on sending that to us just so we get a sense of just what we've been talking about tonight and how they're getting put in place. So thank you.
Thanks. I think I got everyone's. Any other? Nothing from the collaborative? John, you always have an update. You got nothing?
No, I'm late. We're on 5 hours and 5 minutes. I don't have any updates.
Fair enough. All right. Is there a motion?
In fairness, we don't really, it's just the regular meetings and whatnot. And we're still waiting on those masks, which will be, we've got them and now we're going to see how they work. And that'll be, less than 20 cents a mask, which will really help a lot of districts, including Falmouth.
That's
so
great.
That's the only thing.
Thank you. Motion to adjourn?
I'll make a motion to adjourn.
Melissa, second?
Second.
And it's a roll call. John?
John Furnari, yes. Good night.
Andrea?
Andrea Thorrold, yes.
Leah? Oh, I'm going to Melissa. I'll come back to you, Leah.
Melissa Keefe, yes.
Lisa?
Lisa Hart, yes.
Bill?
Yes. Say goodnight, Bill.
Terri?
Yes, even though you missed me on the last roll call, but yes.
Did I really?
Yep, that's okay.
Leah?
Yes, I tried to leave the meeting instead of say that, so I'm sorry about that.
Natalie?
Yes.
And I'm a yes as well. Thank you guys for hanging in there. Appreciate it. Get some rest. Take care of yourself. We're adjourned.
Bye.